Oh, he's not late. Got it by 3
Mark,
minutes.
dang it, you're early.
We're gonna punch.
Yeah, we'll call the meeting to order and let us stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, our agenda lists several department chairs that are going to be presenting budgets, and Greg Widseth, County Attorney Office, is first. So
Can we get a motion to approve the agenda?
we'll do that too.
So moved.
Is there a motion? Is there a second? Second by Warren. All those in favor say aye.
Aye.
All right, we are good to go.
So, like most years, my budget's in front of you. It's like the past 22 years I've done this. It's 94% the same. 94% salary and benefits, and 6% other stuff. And I've told the board, and I'm gonna sound like a broken record. My concern. We did recently hire an attorney.
Yeah, congratulations.
Became licensed in May. We're interviewing someone on Friday too. Became licensed in May. So I think we'll occasionally get applicants that are new attorneys. I think with the way the salary schedule is now, what other counties are doing, and what the public defender's office we won't be able to keep them for any extended period of time. All you have to do is look at Pennington County. I mean, they had to go out and hire a private law firm to do their county attorney work because they can't find anyone to do it. and you know, a number of counties I know, I think at least 2 that have matched the salaries put forward by the public defender's office. McLeod County did, I think Otter Tail County did too. They substantially increased their wages. I know their county attorney makes 192 now. The McLeod County attorney makes 195, which I think is equivalent to what he would make over as a head at the public defender's office.
Oh.
But you know, that becomes my concern. My concern isn't necessarily finding someone to hire. I think you'll fire new grads. My concern always becomes retaining those people. And if that salary for attorneys isn't there, they're going to go. They're either going to go to the public defender's office. And I guess you have to look no further than the public defender's office here now is fully staffed for the first time in years. And that's a direct relation here in Thief River Falls. That's a direct relation to their salaries. And that's why they've had they've had 2 in Pennington County jump and go back to the public defender's office after going one direction. So that always becomes my biggest concern. This budget number here is just the attorneys, just, you know, the standard 3, what we were told to do in any step increases. I did do another one, you know, bumping attorneys up 1 grade just to see what that would do. It gets them close. It gets everyone closer to what the public defender's office makes. You know, but that is going to continue to be my concern. And my other concern is if we don't address it sooner rather than later, other counties will, and we'll be in the back of that thing too. So, you have any questions about that? I mean, I don't have a specific proposal for you. I mean, I can sure bring one forward to you if you'd like me to. See what other counties are doing. I just know, you know.
I'd like to see that. Bring it, because
Okay.
I'd rather see it. And I know I've said it with the other departments. If
Yeah.
we don't stay up with the game, we're going to fall behind. We're going to always be looking, and we're going to lose them to attrition. We're not going to retain them.
And this isn't, you know, this isn't unique to my office. There's 22 offices that have openings right now. You can look at Monoman County. They haven't been able to fill a county attorney position for 2.5 years now.
It does revolve around money.
I don't know that Pennington County will be able to find someone with any experience to walk into that position, because they have to live in the county, right? And you only have so many attorneys that do that. You know,
I know Rose always.
You know, Scott Bueller in my office, you know, I've told you, he's told me that he'll be done next summer when his kids graduate, that he plans to retire at least right now. And that's going to be a huge hit to our office. I will be straightforward with you, especially if we're replacing someone like that with over 35 years of experience in a county attorney's office with someone who's a new grad. You know, it doesn't equate. So my concern is, attracting people, even attracting them from the public defender's office, right? And retaining them. And for the county, my vision more so is the long term. You want to hire people and keep them as long as you can. And I think that's no different than any office. You know, the thing with our offices becomes a little bit more difficult because unlike, and I'm not going to jump on the highway department, but unlike engineering, there's engineering degrees that come from schools all over. There's only 3 schools in this state that produce attorney degrees. They produce about 250 a year, and half of those are 275, I think. And half of those leave the state automatically. And then you've got UND.
And then do they live here? They have to want to live here.
Yeah. And, you know, that's been a historic problem for us is, you know, I can attract someone, I can get them here. They love the job, they want to stay, but family pulls them away or relationships pull them away. And so, you know, that becomes my concern, but I'm more than willing to put something forward if the board's willing to entertain that. As far as the other parts of my budget, you know, there's really not much to it. One is under professional services. Part of that still is the hopeful having enough time, right? And me having enough time. And one of the problems I have right now is it's hard to run an office when I carry a full criminal caseload all the time. And I've been doing that my entire career, and I don't mind doing that, but it's hard to do all these other things like codify the ordinances, which we need to get done. But I need to get them together, and so that is still in the budget. I still could get potentially time to do it this year. I don't know. We've got all kinds of trials coming up, so I don't know if that'll happen, but it's in the budget here. And that would just be a carryover from this year. Maintenance agreement is our MCAPs. Well, and so the professional services and the maintenance agreements, we have that codification, MCAPs, which is our case management software, and then Westlaw, which is our research engine. Those are really the three main expenses in our
What
office.
would it cost us if we had to hire a position out though? To bring in like they're doing in.
Well, I can tell you, I got an email from an attorney, Todd Webb, who was with the U.S. Attorney's Office, and then he was over in Itasca. He retired this year, and he's actually putting out there that he'd like to work. He wants to work remotely. He doesn't want to work full time. He wants to work 2 or 3 days a week, and he's putting that out there to people. He's like, hey, I want to be employed. I'd like to be employed enough so I can maintain insurance, but I want to be able to do other things in my life too. And I don't want to try cases. I want to charge. I'll do all the other stuff, but so it's out there. Yes, Mark.
You had mentioned they have to live in Polk County?
Correct. To be county attorney, right? That's why I was talking Pennington County is going to have difficulty finding a county attorney because it has to be an attorney that resides in the county.
Yeah, and because the one they had was chosen as a judge.
Yeah.
So, and plus they'd been having issues previous to
yeah,
that too. So,
Just for your position?
Just for my position. Yeah. Nope. The other ones we have attorneys that
Clarification.
reside in Grand Forks. That was a misspeak if that's the way it came across. No, I was just talking about that position and that they weren't going to find anyone.
All right. Thank you.
yeah. Are you still using someone like students from UND or?
Trying to, yeah. Haven't had any callers this year, and we have a new attorney starting on Monday, so we got supervision there. So it's we'll see.
If I might,
Yep.
just because, we have our personnel committee that is in the middle of negotiations, so perhaps everybody else isn't quite aware of what is being done there. We have had discussions about all this for a couple of years. We have had discussions regarding options and what to do. We're talking about many different departments with different situations. We talk about what resources are available, what resources aren't available. It's not like we haven't thought or worked on it. And now we are in the middle of negotiations. So we generally at this point normally don't talk too much about what we need, what we don't need, what we have to do, what we don't, unless you want to be very liberal, allow me to be very liberal with the levy. Because you're going to be facing the realities of what we're about to do anyway. And I'm sure some of you are going to go, oh my God, that's too much. Well, this is what we have to do. So say what you want. It's not a zero-sum game. It goes up.
Right.
So be as adamant then as you want to be today about what we ought to be doing. And I can come up with a lot of ideas, and I have come up with a lot of ideas and try to make things work. But sometimes it has to come from department head or board, or somebody else to actually make it happen. So I'm just throwing that out there that there's context to what we're doing at this moment. It does not appear to always to be apparent to everybody. Anyway, Greg and I have had many discussions.
And that's apparent to me. But I will tell you, my office and the attorneys, the only thing that requires a 7-year professional degree in this position in this county. There are different positions, and counties have historically treated them as different positions. And you can see that through the county attorney salaries all over the state, and assistant county attorney salaries. But I will put something together. I mean, I'll put together my proposal. I'm just going to, but I've put together what I was requested to do here. I'm just telling you that I'm not doing this forever either, right? You want qualified. This is a very important job. It deals with public safety in this thing. It advises the offices. It's not just a simple job, and you want people in that are qualified to do it. And if we can't attract them to reside here, they're, the office is going to suffer for that, and the county will too.
Are you up for election this year?
No,
Years.
2 years.
2 years.
2 years.
26.
I'm 57, right? I'll be 57 this year. 57 this year, so I don't have any plans to pull the plug at this point. So I will give you a far heads up if I have, as far as I can. So, but you don't know with medical things, and things change quick. I've got Scott, as you probably know, had a pretty significant injury, shattered his leg, and
Oh, yeah.
he's been working remotely from home, but he probably won't be in the office until November 1st at the earliest right now. It's, things can change really quickly.
Our offices prove that.
It's called life.
Yep.
Mhm.
You guys have any other questions about my budget? The Victim Services was awarded their grant again. So from the state, so it's 105 2-year grant. So I think we'll be on the second year of it next year. So
We should note with Victim Services that the AFSCME union has talked about having those two members in the union. I don't see where it really makes any difference, but they do have unique hours and as needed. But I think we should expect that to be coming as a
Right.
option. I don't think the board will be particularly carried about it. Maybe Greg will, but
Remind me, how many attorneys have you budgeted for?
myself and 6, you had approved us adding one as of July 1st.
So you
So
plus
we-
6.
And are you short now?
Well, no, Tanner's working. So when Tanner Hermanson moved, he's working remotely, but keeping us above water. So no, we're technically not short. We're right.
You're at
Yeah.
6 plus 1.
Well, thank you very much. If we have no other questions, appreciate what you do.
Thank you.
Thanks.
I agree with you, Chuck. Thanks for straightening it, because that's important in putting that in perspective.
well, just because we had some discussion about it yesterday. but,
Yesterday too.
3 of us in this room are sitting down with 2 unions on
Mhm.
Friday. We've got 3 that have tentative agreements. We kind of need to get this
Yep,
over the hump.
I agree.
Negotiating collectively is a lot different than trying to deal with individual department issues.
Correct.
There's things that a contract will apply to, and there's things that a contract doesn't apply to. It takes some individual work to maximize the benefits that aren't in a contract, and it needs some context for those that are in. So we have been taking some of those unique things having to do with the type of department, law enforcement, night shifts, solid waste, licensing, all those kinds of things, and trying to come to something that helps without what we call the Me Too, meaning because you're doing it here, you gotta do it everywhere. And the reality of our grid, which we maintain pretty rigidly to adhere to pay equity, which we are up again, will be tested in January, is to at least have some context for what we're doing for everything. Otherwise, we could just be shotgunning it, which places do. I think Polk County did 20 years ago, and it is as chaotic as anything can be, because now it just seems like, well, you'll address my needs. I come to the board and you do something about it, and we'll get the parade going. At least with a grid and a 3-year negotiating sessions, we get this set. We've done our market studies. One of the problems, Greg is kind of touching on it, but we see it in law enforcement, we see it in solid waste. There's no people, doesn't matter what the wage is, there's no people to get. And if they have someplace they can go for more money, it's generally maybe a nicer work environment, like in solid waste, what you saw yesterday from John. Or you have to physically move here. Okay. So we all know the needs, we all know the problems. I don't know that staying on that aspect is helpful, because it suggests we're not doing anything. We're trying to do everything we can within reason. But believe me, I will be in front of you if we have some unreasonable things that we have to do. I've already had to look at that in a couple of areas.
So when you do retentional things, you have to do them across the board then with each union?
Well, if you're going to give people retention bonuses, for instance, better expect everybody will want one. Why wouldn't they? Now you have to have some reason that you're going to do it selectively.
Right.
And we've had some of those.
Okay.
And I've talked with those department heads, and I'm still waiting for proposals. I've come up with a few of my own. We've had discussions in a couple of committees. At some point, okay, I've tried. Maybe it's not as bad. I don't know, but there's other things to do, and the timing, particularly with negotiations, because really, if we were going to do anything unique, we should have done them February, March. Anything after that, we're in negotiations.
Right.
When we do a market study, you do it after we have a contract settled, so we don't get all those issues wrapped up in the negotiations.
Yep.
And we just had one
We had one 2 years ago,
years ago.
but the point is management. You're in management. The board is in management. I'm in management. Must have an idea of what it's doing first in order to put something out there. If you want to just react to every problem, you're not managing. You're just reacting. And no offense, anybody can do that. So I'll get off my high horse here.
Well, that's a good point. Big,
It's not that high.
several departments.
Since Greg's here, did you send him an email on my request yesterday?
No. Maybe you can bring it up.
We were talking yesterday, and I've been a big proponent of the county starting a overload, very similar to what the state of Minnesota does through the DOT for harvest for beet trucks, so forth and so on. And I've been in contact with the Highway Patrol over the last 3 years. I maxed out admission. We maxed out the civil penalty for overloads, $10,000 3 years ago. And I've learned a lot about the process and so forth and so on. I was told by a Highway Patrol that currently there's a way for civil penalties when they come to overloads, especially on the truck side, that the county can retain some of those penalties, upwards of 50%. 2 years ago, $130,000 of civil penalty type things just for beet harvest happened in Polk County. And, but there has to be this preliminary agreement, which is the permit process. So the Highway Patrol can share that information with Polk County, and then through the civil process, through the courts, or to people paying the fine, some of that money can come back to the county. That was my question yesterday,
Yeah.
how that process works, if you could research.
No idea, but I'll look into it.
So appreciate it. Thank you.
Sarah, you're up next.
Good morning.
Morning. Excuse me.
Alrighty. It's all good. It's all good. Okay. Well, Polk County Public Health, like other years, we have our budget very broken out by each program. And that has to do with how we're audited and how we track our time. And so it looks like a lot of trees and branches, and that's because it is. But it also helps us really articulate the work that we're doing and the areas of public health responsibility that we're meeting or that we have opportunities in. So 481 is generally our admin section. I won't go line by line. The items where you might see what looks like sort of swings is really because we did a process this year with putting lines together. And so the line just appears larger, but it's multiple lines combined.
We condensed line accounts.
Yes.
Mhm.
And so that's where the discrepancy is. I don't have anything sort of unexpected in the budget. There's a few things that I'll call out as we go through it. So the first section here is 481. This is admin. This line might look, when you get down to the tax part, might look more significant than prior years. And that is because last year we took funds from reserves to call down the tax request. And so that was a decision made after the budget proposal, but just wanted to recognize that here. We also had a supervisor position that was placed in a different part of the budget, but reality is they really should have been in that admin space. And so I put them back where their time has actually been spent. So we have that accurate. So 481 and the health admin is pretty standard, nothing unexpected there. If you go down to the next page, 481, we have a variety of new funding sources, somewhere in the neighborhood of 200,000 to 300,000. So if you get to this page, thank you. 414 is our partnership with our Northwest 8 counties. This is new funding we're getting from the state. And this is there's a recognition across the state that perhaps not everyone in the state has the same health protections. And so some of the areas that we have an opportunity to improve our knowledge, skills, and abilities comes with subject matter expertise. But we don't necessarily need one in Polk County, one in Norman, one in Kitson, one in wherever. And so this is an initiative to say there's positions, for example, a data analysis or an informatician that we might need one in the 8 counties. And so this is part of that partnership work. So that's 414. 415 is a similar initiative through the state where we're working with Partnership for Health Community Health Board, which is Clay, Wilkin, Becker, and Ottertail. And this is around communications. And our public health communications work in rural health has been acknowledged across the nation. We presented for the NACHO conference last year. And Partnership for Health is working on increasing their communications expertise, and so has asked for us to do some consultation, but also some shared messaging, so we can mutually benefit from that. So that's really exciting. More than ever, of course, we have media requests and we have public health campaign requests and all sorts of things related to communications. And I would also say our specialty is really on crisis and risk communications. And so we have training and expertise on that. And so this is an area where our expertise has been acknowledged in the state and in the region. So that's 415. 416, if you just scooch down a little, thank you. That is our foundational capabilities money. So this is the area that Joan had been on the work group to help establish our funding across the state. It goes from one page to the next. So no, you're okay. So 416 at the bottom there. We show it bringing in 144,000 some odd dollars. It may actually be more. This is funds that get spread across Polk, Norman, Monoman, and so it's the priorities of the community health board that have to be met. So right now, this is the portion that is coming to Polk, and then there's another portion going to Norman, Monoman, and there's a few loose ends in that funding that we still have to articulate who's going to do what between the two health departments, because all duties are delegated to the health departments. So this number may change as we go through the fall and we finite out who's going to do what within the foundational capabilities. So that's exciting. That's new money. One thing I will mention is on the, I think it's on the top row. It might have, so that last line, 6265, that would be a new software. So just calling out things that are new. We're looking at a software called Clear Impact, and it's around performance management, specifically for public health departments. It's used across the nation. We've done a ton of research on it, and so we're looking at that. But that would be that's a new software, and it helps us understand is what we are doing, is it making a difference, right? So we can look and we know very closely when we say, are we making a difference for our client services, those one-on-one services? This helps us look at, are we making a difference collectively with our community partners on broader health outcomes? So going on to the next page, Ron. The next page is
that all your state funding?
what was that?
Is that all your state grant?
There's state funding weaved into every single branch here. Everyone that has a 5301 code at the top has state funding of different types. There's family home visiting, there's SHIP, there's VEP, most all except for our care coordination at the very end has some metric of state funding or federal funding that's passed through the state that comes to us.
And that's a different number, federal?
Yep, the federal ones, if it comes directly from federal, it would be 5401, right? Yeah. But most of our federal funding does pass through the state. And that's the unique aspect of public health funding, which is also why I get a little churny when the feds are cutting, because that usually has a down ripple effect to us because of how funds are passed through.
I got a question.
Sure.
On page 2.
Sure.
On the gross payroll, you basically some line items got put together, correct?
Correct.
Okay.
Yes.
You might want to check workers' comp, because you were at 17,000 and now budgeted 16. If you're merging, payroll is a function, or workers' comp is a function of payroll. So if your payroll's going up, I would assume your workers' comp is also going to
Sure.
go up.
And we typically just put a number in there because we don't actually, we just get that
That's the amount we
distributed.
get from MCIT that we pay into its insurance.
Yep.
They actually give us the amount by department, and we just plug that in.
No, I understand, but if the payroll is going up here, the workers' comp should also go up a little bit.
We don't come up with, we use no imagination at all. We just put in
What they say.
MCIT's number.
Yep. What they give us.
We're paying a premium. That's part of the premium.
I just kind of find it hard to believe that $100,000 increase in payroll wouldn't have an effect on,
Yeah, and we out that
comp.
number is sort of a last number because we don't.
Well, we don't have a lot of workers' comp claims in public health.
Mm-mm.
That's one of the reasons why we show it in each department. If you start having a bad history, you start noticing that
no,
share goes up.
I understand. It just stood out to me because I saw the decrease.
No, I understand what you're saying.
You're right.
Yeah,
Payroll's up.
Will, but not for a while.
Yeah.
MCIT, at the end of 24, at the end of 25, MCIT will get the actual data in terms of everybody that worked for
Yeah.
Sarah, and then they have a unique code associated with what their duties are, and then they bill us after the fact.
Yeah, we
If
get
they've
billed after.
overcharged us, they refund us. If they've undercharged
No,
us, they bill us. So it
I-
does happen. It takes a little time. So for budgeting, we have to plug a number.
Yep.
Yeah, and I just use the 16,000 relative to the actual for 2023.
Yep.
But to your point, I understand what you're saying. The staffing piece and the relative workers' comp related.
Because I know you'll have a 20% savings in your budget and the workers' comp will get absorbed, so.
When you find me the money tree, we'll get right on that. We'll get right on that. Yes.
Sarah, one other
Yes.
question I have
Yes.
then is, in regarding to the aid, will there be a total then here somewhere, how much total state aid and total federal aid you have at the end somewhere? All
There
conglomerated
isn't on this because this is all broken down by program. I would say I will tell you that our county, our county tax levy dollars are about a third of our budget every year consistently, give or take. And then the rest of our budget is made up of state, federal, and client billing and other foundation money.
That's interesting to me, what the actual state aid is and then what the federal aid is. The reason I ask that is, what do we have to give them in order to receive that, is what I'm getting at. So
Services.
what services do we have to provide to get all that state aid? Are we having to provide them something above and beyond to get the state aid, something that we wouldn't normally?
So some of the state funding is based in the local public health grant, which is we're given X amount of dollars to maintain the public health responsibilities. There's a list of things. And then the other funding is actually grants, like they're considered grants. So we have to
Receive the money and we don't have to.
we 100% receive the money, but it comes with a work plan and reporting requirements and a budget and all of the things. But we need those funding in order to meet the community health needs, right? And so
That's what I'm getting at.
yes.
So they're requiring, in order to receive the aid, they're telling us what we must do.
So some of our funding has match requirements, but a lot of it doesn't have match requirements. Our local public health grant, for example, has a match requirement. Foundational capabilities funding has a match requirement, but like FEP does not have a match requirement. Strong Foundations, which is our family health funding, does not. SHIP does have a match requirement. But when I think about that, I think about a match really, our match is never 1-to-1. It's usually, half or a quarter. And so that's good money for us, right? If we can contribute a little and we get a state investment, and our state investments have been pretty reliable, knock on wood. And so I feel pretty good about that.
Okay.
And a lot of it too, the grants they're like a specific, like data or environment or something, but then we determine how we use the money under that umbrella.
Correct.
So that it fits specifically to our area and our
Local
needs.
needs. Yeah.
Is it my understanding that you categorize the federal programs under the 5401, but then if it's a grant, it's a 5432, and not everyone has a
The 53s are
5432.
intended for state
Funding.
monies, state grant type fundings, and the 54s are federal. So that's the reason. The 5301 is sort of the generic one, and the
Right.
5401 is the generic one. But
Generic.
we do sometimes build specific ones if we feel it's large enough or going to go on and needed, where we'll have 5333 or something like that. Yeah, does that make sense, Gary? We use the 5300s for state as well as we can identify that, and you can sometimes build within there an additional set of numbers. Because if we just want to throw it in the general bucket for state, it's going to be 5301, and federal should be 5401.
Okay, I just saw the 5432 show up, and curious.
You can run a report on the 5,400 numbers for commissioners if you want for any department that has a 5,400 federal money on it for what's the state one 5,300. You could just run a report on those for revenues, couldn't you?
Absolutely.
Yeah, the 5432.
That's what you're looking.
That's what I was getting at. Yep. Okay.
The 5432 for FEP, which is which is some of our emergency preparedness funding, that's because it had, from an audit perspective, it has to be allocated as a federal grant, but it actually passes through the state, and so we have that special marker on there. So that's why that's 5432.
Thank you.
This is what he's looking at right here.
Yeah, okay.
And that's why that,
447.
and that's been like that for a long time. That's how it was set up when that funding was established. That was the expectation.
Oh, I see that one. Yep. Okay. Okay.
Yeah, because MDH gets audited and emergency preparedness funds just kind of work a little bit different.
But it still fell under the 50. Oh, I see.
It's still federal now.
Mhm.
Yes, that's why that one shows that way.
Okay.
Okay.
Go ahead.
So going to the end of, let's see. No, not the end. We're still in this one. 481 515, if you can just scroll down. So this is our federal COVID funding, and this funding will be done at the end of June next year. And so the amount obviously is significantly less. We may have more money allocated for those first 6 months, but we're consulting with MDH to see if we can utilize some of there's two different types of funding that fit under this 515. One is specifically related to immunization, and the other is around staff and community recovery. And so we've been going back and forth with them about we have some money still sitting in the immunization side. So we are asking them, we're consulting with MDH to see if we can do a budget revision and utilize more of the funding available. So there's really, really specific parameters about what you can and cannot use this funding for. So this budget might get altered once I hear back from MDH, but I don't have a formal budget revision yet. So there it is. 519 below that was our previous COVID funding that's done. And so that rounds out our 481 budget. I would say with our health admin budget, we used to have very few additional funding sources outside of straight 481 and our emergency preparedness. And now we have all of these different things that are playing into it. So that's great. We're bringing in more money to the county and more resources. So that's been wonderful. The other thing I didn't mention that's in here is our RSG funding, which is right next to our FEP funding. And that's new funding from the state for emergency preparedness. So we have some dedicated public health emergency preparedness time. So instead of being my 48th hour, we have somebody that is going to have dedicated time. And they just started last week and they are amazing. So I'm very thrilled that we're able to have that dedicated role. So then moving on to 482, this is our health promotion and disease prevention. And this, when we had COVID funding, the tax dollars were decreased because we had a lot of COVID funding. And now, of course, that is sort of coming back to play because the COVID funding is going away. And the health services and disease prevention category is also an area where it's very labor heavy. It's part of the thing. It's if we have TB cases, if we have perinatal Hep B, if we have measles, if we have pertussis, if we have all those things that are very unpredictable, if we have refugee health, all of those things fit under this umbrella. So it's pretty large and we're very efficient. So that all fits under this category. And again, like there's several lines that were previously merged, so that's why it looks a little different. One thing that's not in here that I do need to figure out is we previously had identified locations if someone was needing to be isolated because they had an infectious disease and they needed to recover and not be around other people because of their living conditions or living situation. and we no longer have those isolation opportunities or locations available. And so we are going to need to look at like an outfitted trailer, or like not an ice house, but like that kind of concept, to figure out what we want to do if we need to isolate, because that's a concern that we don't have an answer for right now. So it's kind of a new issue that we're going to be working through, but we need to establish an isolation plan as part of our isolation and quarantine plan. So isolation being for people who are sick and needing to be isolated away from other people.
What department, what number was that?
That falls under 482 under health, disease prevention
That's what
and
I
health
wanted,
services.
health promotion and disease prevention.
Yep. So that's not in here. I'm just saying that's something that I'm
482.
working on figuring out.
What
And
were
it's-
you using before?
We had contracts with a couple of hotels, and those are no longer an option anymore.
Okay.
So we have to establish another plan. If we don't establish a plan, what that means is we have to start up our shelter process, which is very expensive.
Right.
Time, people, resources, etc. And so there's more efficient ways to do that. So we need to make a plan. It's just kind of a new emerging issue, and so it's on my mind. So I'm just saying it here because it's not in the budget. But I'm hoping I need to formulate a plan around that. So just saying that aloud. Okay, also under disease prevention and control, if we go down, 458 is our healthy homes work. This is environmental health. So this is where we do home assessments and interventions, i.e. resources if people need home modifications to be safely in their home. This is funding that it looks like zeros from this year, and that's because our funding had stopped, and then there was a new RFP process, and then we were refunded. So that's why it looks like there isn't funding there this year, but we didn't have it last year at this time, and then we were refunded. If we go down, 475 is SHIP, so this is chronic disease prevention. That's remained relatively stable in terms of people in our work. So this is around nutrition, healthy living, tobacco-free. The funding from the state continues to be the same, which actually means, we're receiving less money because it's mostly salary and fringe. So that's what it is. This is funding also shared between Polk, Norman, and Mahnomen. So depending on where the work happens, sometimes more goes to Norman, Mahnomen, or more goes to Polk, depending on what we're doing. And some years we do receive supplemental funding for special projects in this area. So that's great. 486 is our contract with Intercounty Head Start. I almost said corrections. You were on my mind. That is not our contract with you. So we provide nutrition and dietitian consulting, and that has been a great relationship in Eastern Polk County. And that's literally staff time and mileage associated with that role, and that's been in place for many years. 492 below that is our dental. So this is a partnership that we have with Blue Plus and Blue Cross Blue Shield, and it's related to increasing dental, which we have done in the region. We've increased dental access, which is amazing. Our current focus is on children and families, and our next focus is on older adults, because we've heard loud and clear that remains an issue. And so that is 492. And essentially those are staffing again. And so that ends 482 for disease prevention. Then this next section is 483. This is family health. And so the first section here is 464. This is our sexual and reproductive health services and our TANF sex ed that is in the schools. Our state funding, you'll see on that second line, went up significantly. The state has been very impressed with the work that we've done in the region. So that funding almost doubled, which is amazing. That's 5-year funding. We've had that funding for over 3 decades. We are one of only a couple of community health boards that's funded across the state. And so we're constantly looked at for what we do, how we do it, et cetera, following all of the best practices that are nationally recommended. We also, you'll see the MA building looks down significantly, and that's because we had to have a new provider, and then that new provider also was not able to do as many things right away because they needed to get specialized training. So we'll be working on that. Obviously, if we don't have the expense, we don't have the supplies if we don't have the billing. So it kind of is a wash in that way. We also get refunds and reimbursements from Norm and Nolan Public Health in this line item because we order our supplies together under the federal program 340B to bring down our supply costs, which has been an excellent opportunity. And you'll notice if you look closely at 6272, which is the professional services, that second line there, that's up significantly, and that is up relative to our nurse practitioner service fees and also our labs. So part of our increased funding was to increase our sexually transmitted infection testing because that's a huge issue in Northwest Minnesota, and so that's why that number is significantly higher than in the past. So that's a picture of that. There is no tax dollars in that department. Historically, there has never been. So I always call that out every year because that has been a question in the past. The next section is 466, which is our family home visiting. This area, we've had a couple of funding sources that sunsetted, but really what happened is they took a couple of funding sources and put that into one large one, which is 5473 called Strong Foundations. So all of our family home visiting, whether it's related to child protection visits, whether it's related to the Nurse Family Partnership, which is our evidence-based work, and everything in between is captured in one. We also did get an increase in funding there, so that's exciting to have that funding. Right below that, you might notice that the MA billing looks like it's less, and that's because we had the Blues redid their cards this year, and so there was a discrepancy about how all of our claims were being processed. So we're in the process of resubmitting every single claim since the beginning of the year, and it takes a ton of time.
It'll be a year
Yeah.
until you get paid back.
Yeah, we're trying to be pleasantly pesty, right? So that number will go up. We've had our nurses have been doing incredible work with family home visiting. So super, super happy with their work. And that number will be going up. But if you see it and are like, oh, it's really not that low. And we have great caseload. So we're feeling good about family home visiting. And about the success of our clients. We're mostly excited about them. They're having healthy pregnancies and healthy child outcomes, but also just those self-resiliency, being able to live independently and feel safe in their home and get back to education and work and so forth. So really happy to be supporting them in that way. Let's see here. So going down to 483, 467, this is child and teen checkup and our school contracts. So the third one, child and teen checkup outreach, that's simply based on the number of children on medical assistance, and then we get a certain amount of dollars per child. So that's relative to that number. And then the fees miscellaneous on the bottom are Cathedral and Our Saviors is the first line. The second line is Climax. Third is Fisher, and fourth is Winnie Mac. So that is the school nursing. If schools have less than 1,000 students, they can partner with public health to have a school nurse that provides nursing services. And so we've had that long-standing relationship to provide those school nursing services in whatever aspect that school wants it to look like. So done that for quite a long time. If you keep going down, 484. So that is if you keep going down. 484. Yes, right there. That is our WIC and our peer breastfeeding program. The top program is is WIC. We're able to use a percentage of our TANF funds, which is temporary assistance for needy families. Again, federal funding that passes through the state. We're able to use a portion of our funding for WIC nutrition, and then the rest is our state funding. 484, 491 on the bottom is a supplemental program that you've heard before. We've received state and national attention for the work that we're doing here.
What'd you call TANF?
TANF,
What is that?
temporary assistance for needy families.
Thank you.
Yep, it's 5434, that third line right there. So it's federal funding, but it actually does pass through the state. It just has to have that federal coding. Yep. And there's very specific guidelines about what percentage we can use for nutrition ed out of that funding. That funding TANF funding is for WIC nutrition ed, or a portion of our WIC nutrition ed, family home visiting, and then comprehensive sexual health education. So we do that at the juvenile center and the schools. And then like I was mentioning, the 491 is to receive that funding, you have to receive WIC funding. So that's been great to continuously bring in that, 50, 60,000 each year for several years. So that's been wonderful as well. Going on to 484, this is our wellness and chemical health. So this is, it's a few lines, but as many things that live in it. Our opioid, the portion of opioid funds that comes to the public health department lives here for the work that we do in the health strategist, but also our future Narcan efforts lives in the supplies line. Our match for our local public health grant lives in this. So our staff time, that's the match for that. Our youth advisory board expenses lives here. Our Towards Zero Death coalition facilitating that for the county lives under here. The thing that's not in here that theoretically is coming is the state did allocate funding for local public health to do education around the marijuana changes around cannabis. So we don't know what the expectations are, and we don't know how much money we're getting, and we don't know when we're getting that money, but apparently it's coming. So when we get it, it's going to go here.
Well, supposedly they're going to reinstate it.
Yes. So it's coming. It's going to live here when we get it, but it's not there yet. So yes.
Just, you brought up something about the opioid. You can get Narcan and give it?
Mm-hmm.
Good. Is there plenty of it given out?
So we are so last year we did our own standing order through Dr. Duncan because the states wasn't ready. Dr. Linfield from MDH now has a standing order that we can use, a standing order and protocol. So standing order to get it, protocol to give it. We've had a standing order and protocol for correctional health for a long time, but we now have one that's specific to public health. And so we're utilizing Dr. Linfield's.
Good.
We were able to sign up for that and use it. And so we're doing, actually next week, we're doing a community Narcan training, and we'll be doing one in Kirkston, East Grand Forks, and Boston. And then also after that, businesses or entities, banks, hotels, libraries, whoever wants it, we can do a training just for their entity as well.
They can have it on hand.
Correct. Mm-hmm. Yes. Yeah, there was legislation passed last year that you didn't need a prescription to get it. Although people can go to their pharmacy and get it that way as well.
Sure you can, but I'm talking about you and you. And
Absolutely.
you, if you know your neighbor is
100%.
a user,
Mm-hmm.
it would behoove you to have some.
Absolutely.
You don't want them dying on your doorstep. That
Absolutely.
really doesn't look great.
Correct.
When you can fix them.
Yeah, we talk about it and think about it just like how we want to be equipped to do CPR if we need to. It's the same. It like comes one with the other.
If you can do that,
because you just don't know when that situation is going to present itself and what
the
you
hardest thing is the kids.
Yep.
It's the kids that don't know what they're doing and getting into things, and if you can have it in your pocket or available,
Mm-hmm.
and you see a kid that all of a sudden,
yep,
it doesn't hurt them to take it if you don't know it. If you don't know what's wrong with them,
yes. So those will be offered in the community, and then also separately if entities want it for their entity.
That's what I'm asking. Thank
Mhm.
you.
And we have funds
There's funding for that.
Yes, we have funds earmarked for 2024, and then we have funds in this budget earmarked for 2025 as well.
And that's grant money.
So that funding is coming from the opioid settlement funds.
Oh,
Mhm.
I got it. All
Yep.
right. All right.
Yes. So that is our wellness and chemical health section. Let's see. 469 is our regional prevention coordinator, and this role serves 13 counties in Northwest Minnesota and works closely with DHS. And this is around substance use prevention and supporting coalitions in the region. And we've had that funding for 17 years, I think it is now. So long-standing relationship with DHS and the neighboring counties. We go on. Let's see here, 479. This is our suicide prevention grant. We work with Carleton County to serve 30 counties in northern Minnesota. Our specific jurisdiction is the Northwest 8 counties. And so this is funding that we've received one way or another for the last several years. We have a new relationship with Carleton County as the fiscal host, but nonetheless, it's been a great relationship. So we're providing information about 988 and crisis and postvention, which is what do we do after suicide. We also are working obviously with connecting people if they are in crisis. So that's what that effort is about. So that is the end of that section. And then the last section is 493, which is our waivered services. So this is the Min Choice Assessment, Care Coordination, and Disability Services that we do in conjunction with social services. This is an area where we've been short-staffed all year long, so don't let the numbers fool you. We have a lot of work and limited staffing, so we're working really closely with our team and with social services. This is an area that I'm going to be taking a deep dive in 2025. There's a lot of counties that public health nursing is not serving in this role, is sort of working on a plan for that not to be their role because of all of the state changes and how the assessments are. There's less nursing assessment and more standardized assessments that are being used. And so I plan to take a deep dive in 2025 to just say, like, does this make the most sense for us to have this role? What does this mean to social services? How are we adding value? From a workforce perspective, I get a lot of feedback in this area about nursing skills and so forth. And so I need to look at this more. I've started to look at it this year. It's a rock and a hard spot because it's a really important role, right? It's serving older adults. It's serving folks with disabilities. Nurses and social workers have a knack for meeting people's needs and connecting them to the resources, and yet there is a real reality about are we adding value? What does that look like? Does it financially make sense? So there's a lot of things that I want to take a deeper dive to say, is this strategically the best use of funding going forward? So just saying this is on my mind, and there's a lot of pieces of 493 that it ends up being a tax liability because you only get so much money and there's required expectations and from the state. So it just kind of is what it is. And for example, 5539, the LCTS funding, it's a complete crapshoot what you're going to get. And so there's no really rhyme or reason. We get the payments, we complete the time study. And so it's very hard to be planful in this area. And yet our clients continue to have more health needs, more mental health needs. And so, it's responding to the community, finding the balance, responding to the community need, and then the realities of the program. So all in all, what also is built in here, which you don't just see obviously by looking at it, is a proposal that I have for next year also that I want to share with you. 1, 2, 3, 4, 5. So in a nutshell, we have, which I'm sure you've heard over and over and over again, we have the same workforce challenges that everyone has been having. And our team, just like everybody in the county, our team, of course, is our greatest asset. And so we've had positions posting, we've had people that have opted into different FTE when it's been available. We've had people leave and come and all sorts of different things. So we did a couple of think tank sessions with our team to just say, what are your questions about our org chart? What's working for you? What's not working for you? What are your ideas going forward? And then we had some administrative meetings, and then I met with Chuck and Elisa. And what I am recommending, so currently our structure has some supervisors, but it also has some lead positions. One we had as an active lead position. So lead meaning you lead or coordinate programs, but you don't supervise people. That is a union position. And we have 2 others that are sort of sitting in the union that are available for our use if we need them. And my recommendation after doing a pretty extensive deep dive about where we're going and what staff needs are and what we need administratively is to have in 2025 to have 2 supervisor roles. And we have some positions posted, which I've been doing a little pausing on. So one of our lead positions did go to a staff nurse position because of some personal matters in her life. And so that created an opportunity for us to look at this more seriously. So the current lead position, so if you go from the second page to the first page, the first position on the far right was a lead coordinator, and in 2025 I would like for that to be a community health supervisor so that they can supervise people because otherwise what's happening is that lead is coordinating the program, but I am directly supervising all of those people, and so it does create an odd line of communication about and is not as efficient as we could be. And then the second one is the nursing supervisor position, which would be a position that we would create. It's already built into this budget that I gave to you. And that nursing supervisor position would allow for the roles that are under here require immediate response, right? Like there's things that are happening in the moment with clients and client services, and people need somebody to go to that can be readily available. And so that would allow for that. And also would allow our assistant director to do some of the things that are expected through our foundational capabilities funding. There is work that's across systems with our electronic medical record, with performance management, and there is not time and space for her to do those things right now. And so this would allow for her to be able to do that and for us to be able to meet our organizational needs. So the impact to having these 2 supervisor positions, the impact as opposed to having a lead position and a nurse position, the impact is 23,000. And so when I visited with Chuck and Elisa, that seemed like a good opportunity to be able to have those supervisory roles as opposed to the lead role. And then further, I would say to leave those union role positions there because we don't know what we might need in the future. We have new employees coming to us that have different needs and expectations, and so this is a response to that. And we also have tenured employees that this creates an opportunity to have an opportunity within the agency that they maybe wouldn't have otherwise had. And so that's the other feedback, right? Is we're not only looking at who we're hiring, we're also looking at our great staff that we have, and what is the opportunities for them to have a formal leadership role, because I don't want them going anywhere. I want them to have an internal opportunity if they're the right fit for that position. And so this would also create that opportunity when we think about ladders and building people's skills, because we've been intentionally building everyone's skills, and this would give that opportunity as well. And so from a funding perspective, we've got that built into the budget. And from an operational perspective, that would be what I would recommend for 2025. And all things considered, our tax ask increase would appear to be higher, but we've brought in a bunch of additional funding. So it's actually 70 or 80,000 less than what I would expect it to be if we just made all of the changes to the salary and fringe, because we are 89 to 90% of our budget is salary and fringe.
Can you just address the body count here? Is this an additional position with reorganization or the same number of employees in public health?
Same number of employees in public health.
Just
restructuring
reorganization.
Correct.
Of the
Yes, sorry, I didn't mention that. Yes, it would be the same number. And we did increase this year by 1 because of that emergency preparedness position into a union role. So that it would be the net would be the same effect for next year. Yes. Yes.
This has been a department that has been very light on actual management, meaning non-union management. A lot of time it was just Sarah and Terry Oliver.
Mm-hmm.
We've done a little bit of reorganizing. It's not unusual to have lead positions which remain in the union. They just have a little bit more oversight, but they don't have actual management personnel type responsibilities. But as you can see, there's an awful lot to do here, and I think one of the issues I've observed with Sarah is having too many things on her plate. So this helps. Plus, we have capable people that can step in and do this.
So end the conversation that it's 2 people that would slide into a union type position.
So these 2 roles would not be union positions.
Oh,
They would
okay.
be supervisor roles.
It was
And
out of the union.
Slide the other way.
so because it's a supervisor role, it would be posted externally, consistent with all other Polk County supervisor roles. So if people internally wanted to apply, they could. And also if there's external candidates, of course, they would be eligible to apply as well. For at least one of the 2 positions, I do know that there would be internal candidates. And for the other position, I'm not quite sure, just given people's where they're at in their family situation. But yes, for sure, for one of the positions, there's internal interest by at least 1 or 2 people, perhaps more. But we have through our entire year of strategic planning been talking about workforce in terms of our employees that have been here for a while and sort of ladder and retention and all those things. And then we've also been talking about for new employees coming on, like having those more immediate feedback loops available. And then the third element, of course, is accomplishing the things that we're expected to by the state in terms of our performance management and data. So this is finding space for all of those things, but not dumping everything on Angel or myself or whomever else is involved.
The more you talk, the more I got lost.
Sorry. So yes. So we would not. So currently there's a lead position available. So we would not fill the lead position right now, but we would leave that position available in case we wanted to use that in the future. So it would go away, and we would hire 2 supervisor positions. We currently have a nursing position open, an additional nursing position that we've been pausing on to figure out what we needed to do in the future. So we would hire a nursing supervisor and we would hire a community health supervisor.
Because you were saying earlier, you're not adding employees.
Correct. We're not adding. Nope. So that's why I've been pausing on part of my hiring process from August.
That's the confusion I was having.
Yes. Sorry. No, there will not be a net effect of +1. It will be the same overall number. Correct. Yes.
We're on the same page.
Sorry, I jumped over that because in my head I've been pausing for a bit as I've been thinking about all of this. So yes, no, we're on the same page. Yes. Any other questions? Our budget is still right around a third of tax dollars, which has always been kind of the goal. We always use county tax dollars less, which is also why you sort of see it disproportionately added in the fourth quarter because we don't use it until we need it. So other than that, our budget is pretty, how do I say this, boring? But it is very drawn out by the programs just by the nature of how our work happens. But I would definitely be looking for your support for the 2 supervisor roles because I would want to be planful for that for this fall so that we could get that going in January because until then,
So this would be proposed for January 1st.
yes, it would be. Yes, I don't like making changes like this mid-year. That's just, and we have to be planful, right? We have job descriptions that have to be reviewed and all of those kinds of things. But there's a, the hiring process takes some time too. And so I want it to be consistent with the budget year. And we also are reposting for a correctional health nurse position that's also opening. And this is our second time reposting that. Am I going over your head? No. You're done? We're done?
Or you talk more over.
Who is the correctional health nurse now?
We have multiple. Mariah McGlynn is currently there. We have Mandy Horak, Ariel Netland, and then Kelsey Helgeson is the
In this proposed?
So those are just by programs. That doesn't list all the staff. So the top bucket is Kelsey. So that's like there's a lead role, but she doesn't supervise them.
Okay.
And then below that is 3 nurses.
Okay.
And one will be transferring to a different program. So we're in the process of hiring, but of course we can't move that person until we have the new person there.
Bingo.
So yes. Yep.
No, I'm not looking for a job.
It's generally one of the budgets that I have the hardest time finding something to pick at. But the organizational change is really the thing at this point, and we do have to discuss it a little bit with the union. But when we move a position, create a management position, it's very clear as to what it has to be able to oversee to warrant the points, the grade, and frankly the legitimacy of being a supervisor. The unions are generally pretty good about working with us on this as long as they know that we're being straight and we're not just trying to reduce the number of union positions, because that's not really the objective here.
No, absolutely not. And in fact, we increased one this year with the emergency preparedness position.
Which we
And
will remind them.
And the nurse practitioner is also the top
Right.
union position in the county for the.
The nurse practitioner position is our highest graded union position of all our positions.
Except for the contracted person.
The contracted person is separate for our sexual health services, and that was because we couldn't maintain that the FTE needed for that role.
They don't count as an employee.
Correct.
Right.
Right. Yeah. Okay. Thank you.
Thank you, Sarah. And Joe Larson is up next.
I've never taken so many. I'll let just minimize.
Well, yeah, that didn't take long.
Maybe Tim will help you get that thing on
But
the screen.
everybody else is here the rest of the
Yeah.
morning. So.
Tim?
Will be good. We'll take a little 3-minute recess.
That would help.
I congratulated her, and
Yeah, with her new position with NACO, and
Yep.
that's a big loss for 6W and just community corrections in general in Minnesota.
yeah, but she's like she says, couldn't pass that.
No, nope,
So-
I agree.
But yeah, and then she was wondering if I was going to be with you guys. I said, nope.
And Joe Larson, you're up next.
All right, thank you. So, and I've said this in the past, my presentation looks a little different than maybe what the other those within the county present. So mine's very kind of high level. If there are specific questions as we get into it, please let me know. I think I can probably get to what you're looking for if there are more specific questions. But so before you is kind of my budgetary presentation for fiscal year 2025. So primary factors that are kind of accounting for any increases within our budget. As Sarah had mentioned, in her department, like the vast majority of our budgetary expenses are personnel costs, and we're no different. We're not quite as high as her. We're at 71%. So a lot of staff. So any cost of living, insurance, those sorts of things, those are obviously going to be a big driver of expenses. We do have two union groups that we are currently engaged in contract negotiations. So we have placeholders in place until we settle those contracts. We think we're close with one. We haven't even started with the other one, so that'll kind of add some level of complexity to it. But we do have placeholders within our budget, so as we work through those contract negotiations. One of the things I'll talk a little bit about here, and I know I've talked with my board about, is just the general instability at the juvenile center. And that clearly has a budgetary impact for us just because of really our inability to properly plan because that staffing has been so problematic. Contracted services continue to be a big driver of some of our budgetary increases. I'll talk a little bit just about our general revenue outlook. Actually saw some positive things there, which helped to offset some of the increases that we were seeing. And then I'll just talk about our ongoing fund balance and how that has come down a little bit. So as I said, overall, our personnel costs within our agency for the proposed budget that I have is about a $660,000 increase. Some of that is anticipated increases just through cost of living, steps, insurance increases. Then we also have some new grant funded positions that have really kind of driven that number up. So it's that kind of inflates that number a little bit more than what you would typically see if we didn't have new positions that are covered by grants. Once those grants go away, unless we find additional funding, then they come back out. But so again, we have not currently set COLA and insurance increases. I mean, like I said, we've got placeholders, but until we settle contracts, we won't really know what those numbers are. We did get our insurance renewal rates back from Blue Cross Blue Shield. Our insurance plan is very much like what Polk County does. We're kind of we are a standalone. We're not part of a larger group. And so we actually had a pretty good increase, a modest. So we saw an 8% increase. So we had just a good last year and a half. So that'll be helpful. So will you certainly.
Were you able to negotiate that?
Yeah, so I think it started at 13 and we negotiated down to 8. Because actually when we looked at our experience over the last 12 months, which they weigh that more heavily, like our experience in the last 12 months was really, really good. Like it actually came under what our premiums were. So really good there. And even, when we look back even a little bit further, we had been kind of trending that way. I know that can change very quickly, but so yeah, we were able to kind of renegotiate that increase. So 8%. I think the average is 12% from what they're telling us. So we'll take it. I think 8% is a pretty good rate.
I knew you were working on that. So
yeah, yep. So and credit to Paul. He saw the number and he immediately went back and was like, "Hey, we got to be able to do something," and they accommodated the request. So. As I said, we do have two new positions within or two new grants that cover almost $280,000 of positions within our organization. One of them is our pretrial supervision grant. That is through the Minnesota Office of Justice Programs. That actually covers two positions. And then we have another grant that covers our SUD initiative. So part of that funding is through our involvement with the Reaching Rural initiative. And then once that funding ends in 2025, which I think it'll be about the first quarter, then opioid funding that we applied for through the Polk County opioid settlement will kick in. So we've got grant funding to cover expenses there. One of the things that I'll kind of bring to your attention, we have seen a really significant increase in our workers' compensation insurance over the course of the last 2 years in particular. Last year, we saw almost an $80,000 jump, or actually a little more than $80,000, so it more than doubled. We again this year saw a pretty significant increase, almost $33,000. So over $113,000 increase in our workers' compensation coverage in just 2 years. And like we've obviously inquired, what is driving that? And what we are being told from MCIT is within the corrections field specifically, and I'm guessing there may be a little bit of correlation on the law enforcement side as well, but the number of settlements for PTSD related disabilities is through the roof. That is absolutely the driver in this number. So we're seeing just huge increases in PTSD settlements within that population. So that's really driving that workers' compensation increase. Talk a little bit about staffing changes, and this is just kind of an overall agency change. Like I don't have a ton of movement, so the budget that I've brought before my board does have an additional $75,000 for an increase in our juvenile custody officers at the juvenile center. One of the things that we're seeing is the increase in behavioral and mental health issues being experienced by a lot of the kids that are in our placement. I think back to 10 years ago, and like we were able to pretty effectively manage the facility with just one person on secure detention, one person on a non-secure detention side. That is just not possible. The behaviors, the needs of the kids that we're seeing are so extensive. Like we need to be able to have a third person there during the waking hours from 6 a.m. to 10 p.m. Obviously, that only is in place assuming both sides of the facility are open, because right now, both sides of the facility are not open. So I have made that request. I think it's just an absolute necessity, and I'm not a big believer in adding staff just because like if I'm asking for staff, like I've really kind of done all of the mental work and tried to evaluate different options. This is absolutely one that I'm advocating for because just seeing the behaviors, the needs, the intensity of kind of some of the stuff we're seeing with the kids, expecting one staff member to try to manage that on a side while also managing the other kids that are there, it's just not possible. And it's the frequency of it is the other part of that. Like it's not something that we see every 3 months. It's more depending on the kids we have there, it's more something we see every couple of days. Like the behaviors are just so frequent. So did do a couple of things to help offset some of those things. We had a jail clerk too that has been within the organizational staffing plan for several years. The position is currently vacant. I wanted to see if there was a way for us to absorb the workload that position was responsible for before I made any decisions. I think we can do it. And we have done it for the 8 months that it's been open. So I'm proposing to just eliminate that position. Also, because we've got some grants that are currently in place on our probation side, I think overall we have an open associate agent position right now. And I think we're managing the workload pretty well. So I'm proposing also that we eliminate an associate agent position from the next year's budget. One of the things that I mentioned to my board, I'm going to need to figure out how to put that back in the 2026 budget because grant positions will be some grant positions will be coming off of the board, and so when we filled them, some of those were filled by associate agents that moved into probation agent roles that were grant funded. So I'll have to figure out a way to kind of make sure that they're able to come back into the organization. I've got some ideas on that I'll work on through the year. But so anyways, we have eliminated a couple of positions to help offset some of the additional staffing we're asking for. As I'd mentioned, juvenile center instability is just has been a real problem. It's been almost kind of a standing agenda item for our board meetings, and it all just stems from staffing difficulties. And so we're seeing staffing difficulties on the juvenile center side, which has limited our ability to get both sides open. We're seeing staffing instability on the jail side as well. I think we've done some things to try to address that. But it hasn't gone away. We've made some slight improvements, but I can tell you both of these entities really still continue to struggle with staffing. We had a meeting yesterday with my jail people, and like we've had some unexpected resignations recently. We're not there yet, but we'll be doing some planning. We may need to close down a pod temporarily, as we've had to do in years past, just to get people trained. Because I think what I had mentioned at my most recent board meeting is I think we've got 13 or 14 people in training. So like that's just not enough to get our posts covered. So one thing that I'll highlight, we've been open since March 2023. But in that period of time, we've been fully operational. And what I mean by fully operational is secure detention also being open for less than 3 months. And that's 100% just driven by our inability to get staff. I don't know, when we shut the place down, we made arrangements to attempt to ensure that the staff who are working at the juvenile center would be able to find positions within the organization. And we did that. But because things got delayed, we made arrangements to allow them to work in the jail. That wasn't to some people's liking. So we ended up losing a lot of our senior staff. And now we're down to like one staff member over there, not counting our program director and our case manager. One person has been there for more than 12 months. Actually, no, we're at 2 now. But so just not having any real strong foundation of staff, you got a bunch of new people that are trying to manage difficult behaviors, and like there's just no replacement for experience. So it just takes time. As I mentioned to my board last week, I do genuinely feel like we are making progress, and that's not kind of from a Pollyanna perspective. Like we've got some people that have come on board recently that I think are I get the impression they're enjoying the job. They're just naturally good at it. They're not struggling with some of the behaviors. That gives me reason to believe we're going to be able to kind of expand this foundational group that we really need in order to develop some stability there. So I am hoping that we're turning a corner on that. But the reality is, and again, I've made this comment to my board as well. I mean, if we're here in another year and we're sitting in the same boat, like we're going to have some conversations about what we want to do long term. I mean, because that's just the reality of it. We're not there. I'm hopeful that we'll be able to kind of continue to push through this, but the reality is the instability at the juvenile center it's a real problem because it limits our ability to really plan appropriately. Just kind of doing the cost benefit analysis thing, it becomes costly, and I recognize that. So our budget itself, in terms of revenue projections, I mean, these are pretty conservative. They're really based on the same numbers we used last year. So it's got a combination of, member counties and what we charge them. So we're kind of planning for an average daily population of our member counties on non-secure of probably about 3.5 per day over the course of the year. Non-secure, non-member, we're anticipating an average daily population of 3 over a course of a year. And then that secure detention number, that's the little bit of the crapshoot. We're anticipating a number of 1. I mean, if we could get open and stay open, that number could easily go to 2 or 3, which, if you can get some stability, 2 or 3 non-member county kids in secure detention could easily increase our revenue by $300,000. So again, that's kind of that give and take. And I have in here the numbers that we were maintaining pre-water damage. And as you can see, the blue lines represent what our average daily population was for member counties. And then the orange line is for non-member counties. I mean, we were averaging, 5.2, 5.3, like over that 5-year period of time. And we were almost averaging 5 non-secure detention or 5 non-member county placements on an average daily basis. And I will tell you the need now is more than it was then because facilities have closed down and there's just a statewide need. So, I mean, if we could get there, I really feel like we'd be able to, that would make kind of planning and just the uncertainty around the juvenile center much better. But again, it is what it is. We're monitoring it regularly. But it's I'm not going to sugarcoat it. It's a challenge. It just is.
How many juvenile centers did you say that there are in the state of Minnesota?
Oh, so overall juvenile centers, that have the ability to kind of perform this secure detention and non-secure, much like we do. And I wish I knew the exact number. I want to say it's like 7 or 8.
So not very many.
No, there are not very many, and many of them are very metro located. So, I mean, we've got 3 that are kind of in the northwest corner of the state with ourselves, Clay County, and then the one in Bemidji. But I mean, just as an example, in the short period of time that we were able to get our secure detention open earlier this year, we were accepting placements from Hennepin County, I think Rice County, which is south of the metro, Blue Earth County, like literally 4-hour drive because there just are not beds available. So the need is there. Hopefully we can reach a point where we can help to address that need. So just in general, building costs and other contracted services, I'll kind of go through this real quickly because this again tends to be a relatively bigger portion of some of our non-personnel related costs. So we've seen a pretty significant increase in building and maintenance costs over the course of the last couple of years. Some of that is related to just some adjustments that are being made in the way in which costs are being tracked on the maintenance side. Rich, I think, is probably doing a better job in kind of separating and parsing some of those things out. Secondarily, I mean, maintenance personnel costs are going up, and the building is older. I mean, the building is 16 years of use. And as I mentioned at my board, jails, like they're used pretty rough. Like our clientele is not does not treat it super well. So things need to be replaced at a more aggressive time frame than maybe in your home. So some of it's just the nature of the beast as the building gets older. So we are planning to see a little bit of a reduction in our utility costs for 2025, and we're working with Rich to try to make some additional adjustments that we hope will see some savings there as well. As I mentioned, we're seeing another increase in the maintenance personnel costs, so a fairly healthy increase there. And then just supplies and services in general, fairly large increase being seen on that area as well. I'll give you a little bit of a kind of a breakdown of just some of those things. Some of these are things we've been kind of planning for, because again, the building is just getting older, so shower inserts are rusting out. We got to get those things replaced. The showers, it's from a sanitation inspector perspective, when the inspectors come in, that's one of the things they really look at. If your shower is, peeling paint and flooring that's cracking, like the inspectors will make a big deal out of that. So we want to make sure that we're keeping those things, cleaned and replacing stuff that needs to be replaced. We always leave some money in there for cameras, because obviously cameras, we've got 136 cameras within the jail. So we've systematically replaced all of the cameras over the course of the last 4 years, but we're still going to have cameras that are going to go out. The Polk County quarterly maintenance supplies and agreements. So those are agreements that Polk County has. Then they track some additional expenditures and then bill that back to us. The amount that I have there, if you divide that by 4, that's what the quarterly cost is. So the number I have there is the annual cost of supplies and agreements. And then again, of course, there are just a lot of other supplies and things that we need to kind of plan for: painting, flooring, maintaining those things. The security system that kind of runs the jail and juvenile center, hardware goes down. We need to make sure to plan for that. Obviously, keys and locks and other various hardware. I had mentioned the shower insert, so that is something we are systematically trying to get all of those replaced. Same with Metcraft valves, which Metcraft valves are just valves that you install between cells in the sink and toilet combination. Those have needed to be replaced, and we're replacing all of them within the entire facility. And then we're also, as part of that replacement, replacing them with something that the inmates can't just prop a sink valve and just let the water run, which they're notorious to do. They think that gives them better humidity in the cell. So now we'll be able to replace it so that they can't keep it propped. So that's something that we've been working on. Dryer vent cleaning, kitchen vent hood cleaning, like those are things we need to make sure that we're staying on top of. We had a dryer fire. I don't think it was earlier this year. I think it was maybe the year before. So again, we really want to make sure that we're staying on top of that stuff. So again, just a variety of maintenance costs that are really important. We are fortunate to see a little bit of a price reduction in our food services. That's really driven by just our decrease in our average daily population. So we, of course, will see a little bit of a modest inflationary impact to the food services. The food service provider uses there's a CPI index, or consumer price index, specifically for, I think it's like house out of home. It's kind of a hotel sort of CPI number that they use, and that's the number that they will use to dictate what the per meal cost increase is going to be. We're anticipating about a 4.1 increase for 2025, but overall, because our population is down, we're actually anticipating to see about a $21,000 decrease. Medical and mental health services are another big area of our budget. Largely, the population with which we work have extensive health needs, whether it's like their physical health, behavioral health, and chemical health. Like those are things that we're just seeing much greater needs than maybe we saw 10 or 15 years ago. Like it's just unfortunately the reality of the world we live in. In addition to that, the requirements and the expectations that are being placed on jails, especially from the Department of Corrections, and various standards that jails have to abide by, the expectations now are going to be much greater. They're currently in the process of revising the 2911 standards, and 2911 is the standards that jails have to operate under. It's the standards that we are licensed under by the Department of Corrections. So there has been a lengthy process of rewriting these standards. I actually serve on an advisory group for that subcommittee to kind of work through that. And I will tell you some of the things and some of the expectations that they have, specifically with regard to medical services, substance use disorder response, and mental health. The expectations are significant. So we have, through our coordination and work with public health, we have attempted to be very proactive and get something in place so that when those standards come out, we're ready for them. And I can happily say, I think we are. So I think our ability to be proactive, obviously, Kelsey and her role as a psychiatric and mental health nurse practitioner, I mean, that really provides us with just an unbelievable service and a pretty cost-effective service, considering what we would be paying if we were trying to get that same level of service from Aluma or any other provider. But it's expensive, like it just is. So again, we're seeing a little bit of an increase on the nursing services side, seeing a little bit of an increase on the behavioral health side, specifically with mental health and SUD. One thing I'll point out, so we're planning for about a $25,000 increase. A grant is going to cover about $16,000 of that cost. So, taking the difference, it's about a $9,000 increase that goes into the county contributions. Prescription medications, as our average daily population has gone down, again, that's an area we'll be able to see a little bit of a decrease, hopefully. And then just other medical costs, doctor services, medical services, those are things that we've made some minor adjustments to. It's so hard to know. I mean, some years we have a great year and we don't have any real significant expenses, and then all it takes is one long-term hospitalization that doesn't qualify for, there's some state funding that we tap into to help cover some of those costs. All it takes is a long-term hospitalization that doesn't meet that threshold, and we can take on a $30,000 bill pretty quickly.
I don't understand how that can be. These people that are incarcerated or in your juvenile center don't have insurance or don't qualify for medical assistance, don't have health
Most of the
insurance.
time, yeah. There are some exceptions, but go ahead, Commissioner.
And we're responsible for that health care?
Yes, absolutely. We have a statutory obligation to provide healthcare services to them because they are in our custody, they are in our care. We are
And
obligated
they don't
to.
have coverage from their parents, from
So for juveniles do have coverage. Like we take on very, very, very small costs for juveniles because they are either covered under their parents or through some other mechanism.
True.
Adults, though, almost uniformly, they do not have, because once they come into custody, they lose any Medicaid that they had. So then they become the responsibility of the housing agency. So that absolutely falls back on us. Yep. And we have an obligation to provide medical care.
That system's broken.
And I mean, there's been a push at the federal level to try and get that changed, but
Yep.
so far it's not.
And one of the, and I won't, I wish Sarah was here because she would know the specific provision. I think one of the things that we will start to see is some additional work or some additional opportunities for specifically addressing substance use disorder through there'll be some Medicaid eligibility for substance use disorder. Again, I can't remember the specific provision for it. There is a push at the federal level to expand some of that. But that is a pretty small segment. That is really the SUD and mental health piece, not just your general health. But yeah, to your point, there are very few mechanisms available to us to recover those costs. If someone has to be hospitalized for a period of time, again, there are some options there where we can get them temporarily covered, and that's actually a relatively new funding option that became available 4 or 5 years ago. And obviously, any chance we get, we will tap into that. But knock on wood, we don't see a ton of people who end up having to be hospitalized because I think we invest more on the front end. We've got good nursing coverage. We have the relationship with all true, or a physician's assistant comes over on a regular basis. So I think we do try to be pretty proactive and not wait until, healthcare level rises to where they end up having to be hospitalized. But yeah, it's a huge expense. I mean, there's just no question about it. No question. And I wish I had a better answer for you, but I don't. It's something that all jails deal with. It's unfortunately just the cost of doing business. Oops, sorry. So just kind of our general revenue outlook. Here again, this is an area where we're able to kind of offset some of the personnel expenditures and increases in other area. We're able to grow some of our revenue projections. So we renegotiated our contract with U.S. Marshal Service earlier this year. Went from $75 per inmate per day up to $95 per inmate per day. That actually is a fairly robust increase for us on a revenue side. Also, we anticipate the need for those beds is going to continue to be pretty significant. So we made a little bit of a slight adjustment and anticipating a little bit more there in terms of U.S. Marshal inmates. So we're kind of planning for an increase of about $190,000 in revenue there. Our ABE program, our Adult Basic Education, they really continue to have strong contact hours within the jail. So our ABE program is almost funded almost exclusively by the ABE grant from the state. They were able to see an increase of over $21,000 because they're utilizing Chromebooks that allow the Chromebooks themselves allow them to get credit for distance learning hours, and the books themselves actually track all of the time that the inmates spend. It's been just a really good addition to our ABE program. So we've seen an increase in some grant funding there because of an increase in contact hours. One of the things that I've mentioned to my board the last couple of meetings, so 2 meetings ago, I had brought forward that we were fully anticipating that we were going to lose a large chunk of revenue on our inmate communication line item because of a recent FCC. FCC stands for Federal Communication Commission. There was a recent ruling that absolutely wipes out or almost eliminates the amount of fees that you can charge inmates for placing phone calls. So the ruling is still in place. We originally reduced the amount of money that we were anticipating to be able to receive for our 2025 budget because we were not sure what the implementation time frame was. We have now gotten some clarification on that. So we will be able to continue to receive that revenue in 2025, but in 2026, I think April of 2026, absent a court ruling or some sort of legal challenge, that is a revenue stream that will go away. So we will see a significant decrease in revenue from inmate communications. Last item that I'll cover here. So the Monoman County contracts, we have a contract with Monoman County for housing up to 30 inmates. It's been a really pretty consistent revenue stream for us over the course of the last several years. That contract is due to expire at the end of this year. There's a provision in there that automatically makes it start over or renew for an additional year, absent some action on either our part or Monoman County. Their numbers have really been low. So from my perspective, I think it makes sense to just let the contract renew. If their numbers come back to where they were 2 years ago or 3 years ago, then we look at renewing the contract and kind of planning for some increases just to help offset cost of living and all of those other inflationary adjustments. But the numbers this year have been so low that I'm fearful if we push that issue too much and they come back and say, well, cut our contract in half, that would be problematic. So just again, from a kind of a strategic standpoint, that's kind of what we're thinking. Though again, we are seeing those numbers starting to come back a little bit. And I do genuinely think that is just a blip on the radar. They've had a lot of other stuff going on in Monoman County with kind of turmoil within that county attorney's office and kind of some of that stuff. So I don't think it's something long term. I just don't. Inmate and probation fees, I won't spend a lot of time on that. That stuff is really pretty static. We don't see a ton of fluctuation there. And overall, we're kind of planning for a little bit of a reduction on some of these fees. Here again, this is another area, probation fees and what we can charge for things such as supervision fees, transfer fees, intake fees. With the increase in the CCA subsidy that went into effect last year, there's requirements that we have to eliminate a lot of those fees. So those fees will be going away, I think, in 2027. So we've got a couple of years left of that, and then those fees will go away. I talked before about just kind of our fund balance decrease and what that has looked like. As I said, we've tried to be pretty strategic. We've used fund balance to replace like our security system, which that was almost $1 million project spread out over a period of years. The roof at the juvenile center, which that was a huge success, unfortunately. And then just other things. So we've kind of strategically tried to spend that down. Right now, as of June 30th, we were sitting at about $500,000 fund balance. We've targeted about a month's worth of operating expenses. So, I mean, that's a little lower than, where we want to be. But me personally, I don't think the number is, I think the number is not as bad as maybe what others do. Paul would like to see it higher. I'm not that worried about it, but it is a number that is dropping. And one thing I'll highlight, it really did save us when we had to close down the juvenile center and the jail, when we had to close down a pod, because our revenue just was obliterated because we had to ship people out and our populations. So it really did help us to get through some pretty tough years. Here's just our budget trend. As you can see, pretty steady increases on the overall budget side. The county cost share, that has gone up incrementally as well. I think the average spread out over the 5-year period of time, about a 4% increase is what it breaks out to be on average. So about a 4% increase each year is what the average has been. I had attempted to hide this slide, but it still shows up in here. So it just shows what each of the individual counties have. So Norman's seen about an average of a 0.25% increase. Polk, being the biggest user, unfortunately, their average has been about a 4% increase over the time frame in question. And Red Lake's been about 0.9% increase on average over the years. One thing I'll just cover real quickly, I'll go over the funding formula and what all this means. I'll also let the board know we did make a change to our funding formula, and I think it's a really good change. The formula that had been in place for many, many years, I think it worked well for many years, but with the change in the Community Corrections Act subsidy, there was a significant increase, but with that, it was made very clear, like, this can only be used for community corrections funding. Well, the way that our budgeting worked, like, we just kind of put it in an overall revenue pot, and then it kind of ends up reducing other categories. I think we ran the risk of it just becoming messy. So we redid our funding formula. So now the four prime divisions within our organization, administration, and then our governing board expenses also fall under that. Probation has its own line item, jail has its own line item, and juvenile center has its own line item. Juvenile center previously was just wrapped into jail. So this gives, I think, a much better description of what the true costs are for the counties across all of these areas. So administrative costs and it's actually 75% of administrative costs. The remaining 25% go into the probation line item, just to ensure that we're making use of all of the CCA funding. The percentages, thank you. The percentages there, that is based on the census. So those percentages of administrative costs will be adjusted every time the census renews. So that is one change we made. Then again, we separated out the jail and juvenile center so that those costs are now separated. We use the same methodology in each, which is a 5-year average. So that's how those numbers are arrived at. One of the things that Red Lake County's utilization at the juvenile center is extremely small. I mean, they've gone years where they haven't had a kid at the juvenile center, so it drops their numbers down. Norman's utilization at the juvenile center is actually a little bit higher. So in the grand scheme of things, I think Norman pays a little bit more, Red Lake pays a little bit less. I think Polk's number is probably about the same. Which one of the things we went into this, like I wanted to avoid any wild fluctuation in cost share, and I think we did that. I think we did that. So not only to avoid wild fluctuations, I think it's just a funding formula that's I think is more accurate. I think you get a better sense of kind of where funds are going. The other thing I would say is, I mean, if there are specific efforts to reduce costs in any of these particular areas, it allows you a better sense of what you're really paying. Like we see, hey, our juvenile numbers are through the roof. Like, hey, let's do something to try to bring those numbers down. So again, I think it makes sense from a lot of different levels. So overall, here's what the increase is for Polk County. So my proposal and my request is $247,000 increase, or just about 4%. The overall agency increase is $261,000, a little over that. So about 3.75%. Again, Norman sees a little bit higher of an increase, but then last year they actually saw a decrease. So again, it really does work itself out. Red Lake saw a decrease in what the request was. And then here are just the numbers, and you have those in your packets in terms of how we came up with it. So because we were closed in parts of 2021 and 2022, we have only used full years of juvenile center utilization. And so that utilization also includes any secure detention bed placements that we had in either Bemidji or Clay. So those get added in so that we have a more accurate number of what the average population was for the partner counties. Here are the numbers for the jail. This bottom number here is what we utilize to determine the cost share for next year. So Polk County had utilized about 91.6% of the bed days in the jail. Norman was about 5.4, and Red Lake was at 2.9. And here are the full 3-year, or here are the full 5 years that were used to come up with those numbers. Questions?
Nice presentation.
Thank you.
What was the increase last year for Polk County? Was it like 600 and some thousand?
No, so no. Last year, I think the increase was, I think it's pretty close to this, to be honest with you. It might have even been a little bit less. Last year, we were really fortunate. We saw a big increase in our CCA subsidy, so that helped offset a lot of big expenditures that we were not anticipating. So last year's increase was, well, and I suppose I could even go back into
I could look it up too.
there. So so from 23 to 24, yeah, so call it 250,000. It's probably a little less than 250. So yeah, it was the year before that saw the bigger increase.
Oh, okay.
The year before was 400,000, and as I said, that was unavoidable because the year before that, we had taken the juvenile center out. So putting the juvenile center back in, it was going to see an increase. There wasn't much we could do about that. So yeah, so like I said, about 250,000, give or take.
That's what I was remembering.
Yep. No, I know there was a year where the increase was larger than what has typically been seen, and it was absolutely juvenile center.
Yep.
Juvenile center opening back up. Yep.
What's the average adult population in the jail?
So right now, this year, that number is down about 142. Whereas we don't have to go back that far, and we were 185.
What's the average stay?
Roughly 30 days. Where that gets complicated is we can say 30 days, and that's accurate. But we have some that have been in there for 2 years. Then we have a whole bunch that are literally 2 or 3 days, and then they're out. So that kind of skews the numbers. If we start to pull out some of those really short-term people and some of those really long-term people, then we get a little bit more of an accurate representation. And then I think it's more in the 45-day range. So it depends a little bit on how you calculate the number.
I'm really bugged about the medical part.
I can tell. And I get it. And I wish I had a better answer for you.
Is it against the law for us? The long-term ones are the ones that are costing us to insure them ourselves. Couldn't we save our own money by insuring them? Put them on medical assistance, because the amount of money we're spending there is almost $500,000.
Yep. I don't know what.
Then we can charge that system with the stuff we're using to. I don't know.
Yeah. And I don't know the answer.
That's just a question.
No, I get it. So here's where the challenge comes, and it's realistic. I mean, it's the real challenge. So many of the people that we deal with are awaiting trial, and why that means nothing to most people are like, what's the difference? We don't know how long they're going to be there. Like that is really the challenge. Like we have no idea. We may think they're going to be here for 2 weeks, and they end up being here for 2 years. We may think they're going to be here for 6 months, and they bond out in a week. That's the challenge with that population. It makes it so difficult to plan. And honestly, even on our substance use disorder initiative, it's where we're unique in that we're really attempting to tackle this issue with a population that is really tough to plan around because you just don't know. And to your point, Commissioner, that's what makes it so hard to really determine the best course of action. If it was, because I would tend to agree, if we knew these people were going to be here for 8 months, would it make sense to explore some sort of an insurance would it make sense to do that? Maybe. But we don't know. So that's where the problem comes. And when so it's $500,000, give or take. I mean, that's for probably 15 or 1,800 people. So I mean, if you spread it out that way, it's a little, it's $500, $400 per person. That's actually pretty good, I think.
I hit, I think last year, possibly 2 years ago, on the demographics.
Yep, in the North Dakota. Yep.
Has that percentage changed?
Nope. It's that being a border community, especially Grand Forks, East Grand Forks, that's the big one. That's always going to be a disproportionate driver, and it's so yes, we end up getting a large number of North Dakota residents spending time in our facility. But then beyond that, one of the things we're seeing again as part of our SUD initiative, our ability to provide services to them is limited because there's no funding. So they're a North Dakota resident, we can't get them funding. So now we're a little bit limited in how we can attempt to address the substance use disorder issue. because you just can't tap into funding that you can with someone who's a resident of the state of Minnesota. So it comes with its own set of challenges because of the proximity to North Dakota, and Grand Forks is growing, and we continue to see a lot of activity of North Dakota residents. Absolutely.
Do you see any other more, grant opportunities through the Reach Rural?
So whether or not it's through reaching rural or other
Justice Department?
yeah, I think we will. And typically the spring of the year, kind of that March through May is a big federal funding cycle. I am very optimistic that is something we will be able to tap into, especially now that we've got some infrastructure in place.
We're going to be having some data to prove
Yep.
it also.
Absolutely. So I am hopeful that we will be able to tap into some funding, especially a lot of those grants, like they want to see collaboration,
Right.
and we've been all about collaboration. So I think we can make some really compelling arguments to be able to continue that funding long term.
Yeah, that'll be good.
So on a positive note, I mean, the jail grants or bond payment, all that'll be done in 2027. So that's a positive. It's a few years away, but it's coming. I'm sure you guys are.
What was that one again?
Yeah,
know about it.
I'm sure.
It's on my calendar.
I'm sure it is. Other questions? All right. Thank you, everyone.
Mr. Melby is up next.
Do you want this chair on?
This is perfect right here. I'm gonna need Tim to get me back over. Is that right here? Maybe it's right here.
Well, good news, my budgets aren't nearly as complex or complicated as the last two that we've gone through.
Appreciate that.
We treat all budgets the same, Sam.
Understood. Just understanding those budgets and how they
Nobody
arrive
gets
at.
any favors here.
Assessor, licensing, data, elections, recorder.
No.
Recorder
And the
compliance.
compliance and tech, well, and then the extension offices.
Extensions, yep, 550 and 550.
Yep.
That's right, yeah, you take all the boxes. Click all the boxes. Yeah.
All right, so the first budget we have is for the Taxpayer Service Center, or the Auditor Treasurer budget. This one, honestly, there isn't much change on any of it. The increases are going to be like everybody else has said in the personnel. Looking through it, like I said, there's nothing that I've increased. In fact, we've come down on a lot of things just after looking from the past couple of years and where I've spent, or where we've spent. So the one increase is in the overtime pay. That was a little bit out of the ordinary. We've had more people being interested in helping with our scanning project, so they put in more hours. So I've upped that a little bit just because it's the help we need for those projects. So it's been good. Any questions on that particular budget? Because like I said, that one, the only increase was in the salary, wages, and benefits, and everything else would kind of either stayed the same or came down.
So that's more in the 80 or 90% of your budget.
Yeah, it's I think overall on all of them, it's like 77 or 78% of my budget is personnel.
Okay.
So the next one is the assessor's office. If you can go to the next page. I guess on the prior page does have the overtime pay, and in this one, that's accounting for some new staff and possibly taking a little bit more time to get the work done or entering and learning that process. So, talking with Mark in that office, that I think we might need a little bit more time, just because we do have so many new ones. So if you go to the next page, in this one, the professional services, that includes a CPI conversion for our ag land, which is estimated at about $10,000 to get our tax system or our assessment off of this. What do they have right now? It's more based on sales and everything instead of actual crop production. Like the CPI, the crop production index, we think it will be a much more accurate and equitable way to assess the ag land. So that's what's included in that particular one. The other increase is on the office furniture, office machines. Their tablets that they use out in the field are on a 4-year rotation. This is one of the years, or this is the year that we would be needing new ones. So we would need 7 of those at roughly 1,800 per machine. They'll be working with IT or through IT with purchasing those. Any questions on the assessor budget?
You said what was it, the CPI?
Yeah, that's what they're going to convert to or want to convert to.
So the sales then are thrown out, or is it
would,
weighted?
It's more weighted, and it just wouldn't have the effect, like, because right now, if say you have a 20% increase on your ag land, if the way, over a few years, if that happens, it gets disproportionate. You could have something across the road that is so different that I believe Mark feels like the CPI will do a much better job of equitably raising and uniformly raising the value or lowering the value when those adjustments are made.
And that's something the state allows in the whole process, the CPI?
Absolutely, yeah. Yep. There are other counties that use it. And Mark's been working and looking at it and wants to get it implemented.
And where is the yield information? Where is that generated? Through the FSA office?
I would assume, but I wouldn't.
You don't
know right offhand. I'd have to check with Mark. And if those are, I think he'd be open to sending any of the info that he has on how the conversion would work and what it would be if you're interested in getting that. We can definitely send you everything or everybody, all of that. Right. Anything else on that particular one? Assessment? If not, we can move on to the license center. Again, not much change here. In fact, no real changes besides the personnel in that one. The personnel might decrease again with my estimate because of just some minor changeover in staff, so it wouldn't be a whole lot, but we would have somebody new starting now, and we'd have somebody new starting, well, once we get through that process, but they would be lower on the pay grade scale than the current that we first calculated with. Any questions in the license center budget? Okay, if not, then we can move down to the data processing. The big increase in that one, As you can see from in 2024, the actual, at that 500,000, that included the 240 some $1,000 for our tax software that we've been planning for. You see the 95,000, the prior, budgeted in 23, but nothing really spent. It was in anticipation of this tax software coming. We didn't have, it was a little bit higher once the final contract was negotiated. But we were, like I said, anticipating and looking forward or knowing it was coming. So now the increase from the 24 budget to the 23 does include 136,500 per year for this tax software update. It's a 3-year payment plan with them, so it'll be in 25 and 26's budget. That excuse me, the other stuff that's also included in there is our MCCC fees for 5 different user groups that Polk County is part of, and those user groups are at $2,300 a piece now, and after they increase their fees there. And is there any questions on this particular budget, the data processing? Okay, if not, we can move down to the elections. It pretty much gets zeroed out on non-election years. The 11,500 in the overtime pay covers part of one of our part-time. It's a third of one of our part-time employees' estimated wages for the year, and she is invaluable to us. Like Diana Amiot does a wonderful job helping us with a lot of the technical stuff that we do, a lot of our testing for the elections. She does fantastic for us. So any questions on the election budget?
Want to touch on the maintenance agreement?
Yeah, it's the stuff we have to, or that we maintain every year with our election equipment, where they send somebody to come in and help maintain our equipment or to double check it, so or to do any service on it. That's where that agreement stays.
They being
ES&S are equipment supplier, so election services and supplies, I believe, is the ES&S. So then we can move down to the recorder's department. Again, on this one, no real changes. The only estimate changes are in the number of documents that have been coming in. They've been going down over the last few years, and so we started budgeting less in the revenue side. Last year, I think I budgeted at 5,500 estimated documents. This year, it's estimated at 5,400. Just from what has gone on, it was steadily increasing, and then 2020 hit, and it really jumped. And now they've started coming back down to the pre-COVID. There just hasn't been as many transfers, and with the way the market has been for real estate and everything, it's just slowed down. Any questions on the recorder budget? Okay, then we can go down to the extension. And this is for the extension board. So there's a per diem for each member coming to the meetings. That's where the $840 comes from. It's $35, I believe, per meeting. Let's see here. Oh, the one we did take out is the $275, and the $19 would have been for a meal provided at the beginning of those meetings. We will no longer be doing that, and we'll be going over that at that meeting tomorrow and letting the extension board know.
I think Joan and I are probably gonna suggest a change in schedule if that's an issue to.
Yep, just so we don't
Wait time
meet over
before a
that
meeting.
lunch hour.
Yes, just move the meeting time.
Yep. Right, so then the next one is the actual extension office, which is in McIntosh. Um, the increase on the payroll here, the other salaries here is on that estimated MOU that Lisa presented yesterday, or so that's where those estimates come from. The lease agreement for the building in McIntosh has not been changed, so that will stay the same. Other than that, there's nothing that changed in this budget from the extension office. Any questions on that particular one? If not, we can go down.
Did I miss something? Oh,
Oh,
yeah, the
that's-
76ers.
yeah.
I must have missed, I don't see them coming up.
Oh.
Give me a minute, I'll be back with those shortly here.
No problem. All right, so the Recorder's Compliance Fund. This one is where we budget for our pictometry in the professional services. 20,000 of that is what is for pictometry. GIS used to ask for $10,000 per department, and being our assessor's office and auditor treasurer's office use the pictometry quite a bit, I felt it was fair to decide to contribute 20 from our side to that. I was also letting Jake know that I haven't seen an invoice from GIS in the last few years, and I don't know if that was the turnover with Rick and Nate and how they billed for the pictometry, but Jake and I have already talked about it, and he's already got an invoice ready to send to our department so we can help pay for that. Another 5,775 of that is for our assessor's website through Vanguard. And then the rest of it is equipment maintenance for the scanners that we have. And that's that particular budget. And then the technology fund. Oh, yep. Did you have any questions on that one? I guess I should say. Nothing on that one. Okay. The Recorder Technology Fund. This is what pays for our part-time scanners. So not the people who come in and do overtime, but more employees that come in and work when they can at more of a part-time level. And we'll be having a couple more. I was approached by a few other folks to become part-time employees. Like one used to be a custodian with the county, and as she's going to college, she wanted to see if she could still do some hours. So we worked her into that budget. But other than that, no real changes in that one. And again, the recorder fees are down because of the estimated number of documents. If there's no questions on that, I believe those are my budgets. Tried to save where we could and adjust down where it's shown that we've been trending below what we've been budgeting for. So. All right, if no other questions, thank you very much.
Thank you.
Want to take a quick break?
Yeah, we'll take a quick 5-minute break, huh?
We need Ron in here to open up her budget, which
I mean, I
shouldn't
could
be
start talking
too
through it.
hard. I wonder if it's-
You folks know my budget's pretty straightforward, so
Mhm.
no major.
You don't get in more than 15 minutes either.
Oh, I'm gonna take up 16 just because you just said that. She's a rebel. How about 10?
That's stretching it.
I think that's it. Yep.
she doesn't need to talk about health insurance.
You don't want me to?
No, I said I do. I said
Oh.
you have to.
Yeah, yeah, I can do that. Just an overview of kind of where we're at.
Yep.
Yeah. Okay. Good morning.
Good to go.
Go. All right. So we're just going to walk you through my personnel budget here for 2025. Pretty straightforward, but wages calculate out 2 people, myself and my HR generalist. A little bit of overtime pay. Of course, I calculate that in typically around open enrollment and keying in, making sure we get everything keyed effective January 1st, 2025 by December 1st. So there gets to be a little bit of longer days between October and end of November. A little bit of overtime. Cafeteria benefits. Again, I absorb a former employee terminated now who was medically injured. So I do calculate that out for 3. So 2 staff and a former deputy in my budget. Para straight out calculation, Social Security straight out. Postage, I put a little bit in there simply because if we have an employee who parts ways, or unfortunately in the case we have an employee death, mail stuff back to their house, so I always have a little bit there. Publishing, advertising, you're going to see an increased amount in my budget for 2025, simply just because, well, a couple of reasons. Labor market continues as it is. We constantly have turnover, so we're always advertising in our local papers, as well as different venues. I've been posting some of our harder to fill positions on Indeed as well. That sometimes has a cost associated with it. But then I'd like to start posting and become a member of the League of Minnesota Cities. So that's about a $5,000 ask in my budget. I think it would be good to get, hard to fill positions, deputies, attorneys, and those types of positions out in city advertisements as well across the state. Subscriptions. This is really like my vault clearinghouse. This is background checks, poster compliance, anything that changes, from the state every year. If there's something that comes down in Minnesota State, minimum wage increases, anything from OSHA. I got the 7-in-1 labor law posters that are posted around all of our locations. Those generally, that's a cost associated with it. So just asking it to stay where it's at. Membership dues and registration fees, that'd be my macrame organization fees and dues. SHRM memberships, some of these organizations that I participate in from an HR standpoint, there's some dues associated with that. Insurance admin fees, you may have recalled, this is the PCORI fee that we've had to pay for in the past, but when we went to Blue Cross Blue Shield and got out of the co-op and became fully insured, Blue Cross Blue Shield actually absorbs that cost for us. And what that is just a affordable care tax associated with how many belly buttons you have on the plan. We don't have to pay that, and I didn't know when I was going through my budget earlier where we were going to land for healthcare for 2025 or what would be selected for the county. So I hadn't budgeted anything in there. So you notice it was a 0 because last year it was covered by Blue Cross Blue Shield. I'll give you an insurance update at the end of my budget, let you know where we're going to be for 2025, but nothing is budgeted for 2025 because of our healthcare courier staying the same. Professional services. This account is typically where we, when we deal with our labor attorney, pay out of this account. Anything that with Pemberton that we do regarding negotiations, any formal disciplinary high case, Loudermill hearings, last chance agreements. I partner with my labor attorney for those types of
progressive disciplinary action steps in the county. It's also WEX fees are associated and coming out of this professional service too. Our WEX fees are who administers our VIVA and HSA accounts. So for everybody who has account, we have administration fees every month that's paid out as well. So that comes out of this account. Mileage, I've calculated in there, traveling around the county to and from some conferences. I have my HR generalist as well that's driving a few places here and there and out to Boston to help. So it's just typical mileage. Travel expenses, conferences coming up next year, looking at an AMC conference, looking at a couple of different conferences, maybe through MCIT, and they may be offering some HR technical days, which I'm really excited about, that I would like to send my HR generalist to as well, since she's new in position. Software license and software, the next account, 6342. This is my Kronos account, and this is where we pay out our monthly charges for having 6 Kronos time clocks around the county. So every month we pay a fee to Kronos / it's UKG now. But right now, I do not know if we're going to receive a possible increase. We generally don't know what type of increase we're going to get until like November. So I haven't increased this. I don't anticipate needing to increase it. But that may change a little bit later. And then we are looking at doing, if we continue with Kronos for UKG for our open enrollment system in 2020, for next fall, not this fall, but for next fall, there's a possible way to streamline it and make open enrollment a little bit smoother for processing on the backside for my team and myself. And we're looking at adding what they call an EDI feed, which is just an electronic data transfer of information to Blue Cross Blue Shield or whoever our healthcare provider is. So I am looking into what that may cost me out of this account. It's probably about $4,000 for one feed, but it does reduce the amount of keying and transferring all of our employee data over to Blue Cross Blue Shield, and we do that manually every year. So it takes quite a bit of time and effort. And if we continue with this process, I'd like to look into that going and working with MIS on that going into 2025. Unemployment compensation stays the same. I add a little bit in there, 500. Supplies, basic office supplies, some reference books and materials. Several leadership training or leadership book. I'd like to have some opportunity to provide that to new supervisors or new directors in role, and work with Chuck on that. Really nothing for equipment or capital. And then the staff education, I know that I budgeted this last year as well, and it always seems to sneak up, and it's something that I need to schedule with Pemberton, because I really think it would be very helpful to new supervisors in position. But our labor attorney would potentially come up and provide a very all-day supervisory training for new supervisors. And if I can't get our labor attorney, I would look at somebody else, another one of his assistants, to do that this year, just so that we can get it, because he gets pulled many, many, many different directions, and then it just gets away from us. And so that's really what I would like to do for 2025. Questions? No? Okay. Just provide a health insurance update for everybody. So as you know, we were in our 3rd year of our 3-year contract with Blue Cross Blue Shield. Our contract with Blue Cross Blue Shield expires on 12/31 of 2024. So all summer, what I was tasked to do was to submit full requests for proposals to other healthcare providers to see what would be the cost-effective benefit plan for the county this year. I had a committee made up of employees, a benefits committee, about 12 employees on that from different unions across the county that participated in that, and reviewed PEEP healthcare insurance for the county, Medica healthcare insurance for the county, and then Teamsters healthcare insurance for the county, along with wait for our Blue Cross Blue Shield renewal to see what that would be in 2025. Our utilization is very high for our county with our plans, which is typical. We have a lot of employees. We're users of our plans. But we were anticipating up to like it was like a 46% increase for benefits this for 2025, which very, very high, very, very high. So hence why we went out and did, submitted requests for proposals to the other healthcare providers. We just received, throughout the summer, we've been meeting with the benefits committee and then these providers to discuss what they could offer. And within the last couple of weeks, we've received the Blue Cross Blue Shield renewal, which proved to be very good and was something that we were not really anticipating based on our current utilization. And so the benefit committee unanimously voted hands down to stick with Blue Cross Blue Shield, but we will still see a 19.8% increase to our current premiums. Our deductibles will stay the same, but we'll see a 19.8% increase. With that being said, we opted to sign another 3-year contract with Blue Cross Blue Shield to help, I guess, to help reduce our cap, like reduce the amount of increase we would receive in 2026 and 2027. So our cap rate increase for the next 2 years for 2026 would be up to 14.5%. Doesn't mean it's going to be 14.5% in 2026 and then 15.5% in 2027. Still much lower than any of the other full requests for proposals that if we would have left, if the county would have went back to or switched to someone else. So the benefit committee felt very strongly that this was, the healthcare provider they wanted to continue to stick with as far as ease of the plans and where people could go and for the providers. So I guess I'm happy to say that. I think, the benefit committee did a great job digging in and just analyzing the coverage options, everything from pharmaceutical formularies down to, which doctor was in network and out in network and things with Mayo. And like I said, these folks are very, very well versed with how our plans operate. So they did a nice job, and I'm glad that that has been finalized. But
19.8% is what we look at for next year.
correct for our current rates. Now, our law enforcement folks are on the PEEP plan, and I'm still waiting to see what their rates are going to be. I should be getting them this week or next week. They always come at the end of September.
That they will likely stay with that plan.
Correct. More than likely, yep. They may not, but they have been on PEEP for some years now.
And their contract is good through
So
2 years?
so that has typically been a 2-year contract with PEEP, and now if we renew, so we are on our 2nd year of our 2-year contract, so we need to renew, but PEEP has now went to a 4-year contract, so they would be electing to stay with them for 4 years now.
So it's 19.8 now, and 26 is 14 what?
It'll be up a cap rate of up to a 14.5% increase on our rates from 2025, and in 2027 from those rates from 2026 it would be up to a 15.5% cap there. Doesn't mean it will be. It could be a 9%, but it's based on utilization.
Correct.
Question on those percentages. So this year it's 19.8. Is it an additional 14 potential additional
Correct.
14.5 or max at 14.5 of the 19.8? Big difference in calculation.
No, you got it. You were, so the 19.8 is calculated. So those rates for 2025. So whatever those rates calculate out, then it's those rates plus another 14.5 potentially or lower for 2026. So like our rates currently right now, we can look at our rates now and calculate. I can even calculate what 19.8 will be for our 3 deductible plans, and those will be the 2025 rates. And then when you look at those rates, then it could be up to 14.5% for 2026 max.
And same with the 15.5
Correct.
for 27.
Correct. Yep. Keeps
Over
going up.
3 years.
Keeps going up, as we know,
50%.
healthcare in the healthcare industry. So, but I'm very confident that that this will, we continue with Blue Cross Blue Shield and we're offering affordable rates for attracting hopefully newer folks with families to the county, as we continue to have turnover and folks retiring and leaving. So it's important to stay very competitive with our healthcare and our total compensation package.
Is this Blue Cross Blue Shield, Minnesota or North Dakota?
Minnesota. Yep. And then we'll stay with our with Integrity Benefits, who offers our ancillary benefits, so our Delta Dental, vision, long-term disability and life insurance plans will all stay the same. Rates will be unchanged. So that was nice to hear from them this year.
Because they stayed, this is what, second or third year they're staying the same.
Integrity has always been, but Delta Dental, now this is the third, it'll be the third year. Yep.
Blue Cross Blue Shield rate increases, is there any change to the copay and or deductible
No,
percentages?
no.
The middle plan is going to.
The middle plan will go to 3,300 instead of 3,250. So it'll be 1,850, 3,300, and the high deductible is 6,350.
Which in the marketplace is not a high deductible, but
Right, and go up to higher deductibles, 9,000, 10,000, higher, right?
17.5
Oh wow.
is available through Blue Cross Blue Shield.
Individual, self-employed type stuff, yeah. Yep, yeah, I'm aware of that.
Well, even some group plans.
Oh. Mm-hmm. Mm-hmm. Okay.
Used up all 15.
What's that?
Used up all 15.
Okay. Well, it's not 16, Warren, so. Any questions? No? All right. Thank you.
See you on Friday.
See you.
Oh, shush.
Just go. Okay. Bye. Have a good day.
Yeah.
Ron is up next.
Yeah, get something here for you. Here she comes. So like in addition to what we call our finance department, I put budget numbers for a couple other things, departments in the general fund. We'll just go through them numerically, I guess, here. First up is number 45. That's the internal audit. That's an area where we've put the outgoing cost of our audit, annual audit, into this thing, and then we would take money back from the funds to the extent that our auditors tell us which fund they worked on. We would rebill those in the funds and then move that money internally. And so that's Colleen, our current auditor's number is 143 per year for her 3-year agreement. That's what I've got in there. Under the auditing professional services, and the 45,000 is my estimate of what was going to come back. And then we also in here have an expenditure, I think every year from, if we're having a private firm as we do now, the state audit will also examine their version of our audit and bill us like $500 or $1,000 or something called a desk audit. And they were just doing that because I had some correspondence with them, because they do review the outside auditor's work as well, and you get a small fee for that. And this will probably be the first time Chuck's hearing it, but I'm going to just discuss it because it just came up last week with Colleen. That she does, among the things I mentioned yesterday, she does would prefer that we don't do this thing where we push money back in. I consider it fairly minor, and I think this works pretty well. But she would like me to not do that, and I would be happy to do that in 25. Just bill out directly to to each fund. Like social services is going to be a big part of it, and highway is going to be a big part of the audit cost. We can bill that out initially from that fund in that manner and not reimburse it back, which would essentially make 45 basically go away, is the way I'm picturing it. Um, I, I don't mind doing that. We can do it. It just you wouldn't see this anymore. But go ahead.
Well, I was going to say before you informed us of this, can you just share with them how the refund and reimbursements work, where those are coming from, and what the true cost of the audits are?
Yeah, the audit will actually. The true cost of the audit is down there in the professional services, that line 6272, and there's a major overlap on the actual 23 number because we had bills from the prior. They do run together. So if you wanted to know the actual cost of any one audit, you'd probably want to ask me in advance, and I can easily call it up. Yeah, but then that was with the state auditors, and that's always kind of an ongoing number. You never quite know what it's going to be. But now with Colleen, she's contracted to a flat amount. So unless something would happen or she'd go over, we know that amount. But yeah, so then the audit bills that I get, if I get 5 or 6 bills from Colleen and Company, they're gonna say she worked on this fund for $1,500, and I'll get that fund a bill for that. And she's saying when my bill comes, just bill the road and bridge, or just bill the social right from the start, if you would. And okay, I mean that's fine with me. It might actually make my job a tiny bit harder, but I don't care. If she thinks that's better, that's fine. And then what I had in mind was, just continuing on at that, I thought I would just put this under the audit code in the unallocated of the general revenue. And then each fund already should have a budget, they're guesstimating, of course, but they should have a budget for audit costs for their fund. So if that works, we probably, on the later versions of this will go to zero, and and because it won't have any refunds, and we won't track it that way. For finance, I feel like it's probably a work in progress yet as we go into the fall, but I did just put in the the prescribed increase for the instructions. I don't know that the staff will be that same throughout the year, but we do need some placeholders and some numbers in there.
Right.
So that's what I've got going on there. I do pay for all the accounting software out of this department. So that's the number that you see down here. It's the major number. I guess we didn't spend any time on Sam's this time, but it's most of it, vastly most of it, is paid to the County Computer Cooperative, MCCC, and they send us a bill. So I pick out my software and he picks out his, and we just put it in our budget from there. So that's how I would have achieved this number there. The payroll accounting process, that is another big number there. I'll get back to the one above it. I just noticed it. I'm sorry. What that is, I've said it before, but this is billing. This is the general fund, the county paying social services for some hours of the general county payroll processing. They give us a bill estimating that their hours that payroll has spent doing non-social services payroll stuff. Has to go somewhere, so the county pays it, so social doesn't have to pay all that. They like to keep it, separate because they're all on grants and federal monies. So that's why that one exists.
If payroll moves back to finance or moves to finance, that number changes, or is it inverted somehow?
I would guess then it would literally go away, or maybe be inverted. If then we maybe want to get some kind of cost pushed back to social for their share of the 100 people, or the third of the payroll processing. Yeah, so that could go away as an expenditure. Perhaps we'd find a way to reimburse it.
You guys following what we're talking about? Because a lot of what they do can be reimbursed, but they're doing all payroll, right? They've been doing all the payroll, but it's probably not where it should be. It should be, I think, under finance, but we've got some steps to take clearly if we're going to do that.
And so, yeah, and this, I guess I would just say, my budgets have kind of been the last item on my to-do list. And so I'm sorry I didn't have this one on top of head as I rolled in here, but this, I believe we have a 3-year agreement on our hardware, software that runs all those products. And I think that's due. That's why we see a jump there. I will check with that. I think Levi might even know he's coming in a while, but otherwise I'll check with the provider and make sure on that. But I believe that was coming due. I wanted to put a placeholder in there, so that's what I've got going on with this number. You don't see it in the other 2 years because it paid a lump sum and then we're good for 3. So yeah, I guess that's it. I mean, I don't have any statement for you on when I'm going to be done, but I'm planning to be done retiring or moving to less time or something like that. So I don't have a number for you at this time, but I'm open to all kinds of different discussions. If I could go to part-time or whatever, somewhat, I could free up some salary for you. I don't know, but I'm open to all kinds of win-win situations with regard to 2025 and, the work that we do in that area.
You've also had turnover in your office this calendar year.
Yeah.
And how's that going? I mean, do you want to share with that?
We're still well behind. We're literally in a very tough situation earlier in the year, being as shorthanded as we were. But we're coming along. We've got one particularly good trainee coming in. The job that Arla had, that banking treasurer function, was pretty major, and we lost her on fairly short notice. But we did get it filled. But it was difficult during tax season and all that stuff. And even today, I'm still doing some portions of that job because I'm trying to let the trainee pick things up, at a reasonable rate, the way I would want to do it. So I'm still doing some of that job even now. So it's been a challenging year. The loss of Randy, that's in our area in a sense. Sherry moved, so we have all these people near us that are a lot less trained and experienced than they used to be. It's also true in my department. It's true in public health. And so all those things are causing a lot of errors. A lot of what I do these days is is spending time trying to unravel some errors and mistakes made by the newer people. So I'm not really very caught up, to tell you the truth, but we're still going. We've avoided disaster in a couple of areas, and I think we're still moving on.
Yeah, if you want to talk, we can talk, and I got this thing I gave you yesterday. We can kind of meld those things together and figure something out. Like you say, win-win.
Yeah, a lot of different options could be discussed. I think you need lots more accounting help. I don't know what that looks like, but I think the auditors, we just covered the audit department. I kind of shared this with the finance committee. The current auditors, this private firm, has very different expectations and requirements, things that they won't do, things that they think are important, as opposed to the prior auditors, which was the state auditors. And I've been about half and half with those two different firms, and very different things that they will do for you and they won't do for you, and things that they think are important and things that they'll let slide. Super different, I'm kind of flipped between the two of them, trying to keep both going. And I want to work with either group, whatever it is, and try to do my best and get along very well. But the common theme is we just don't have enough people working on it to get that audit up to speed, that we rely too much on that outside, whether it's the OSA or the private firm. We need to figure out how to get more of that accomplished internally, and on a quicker time frame. And I think that's the common theme that both of them are saying. I think, I don't know if Colleen will want to be with us for the 25 audit or not. I get a feeling perhaps not, but there's still time. There'll be a discussion about that, presumably about this time next year, right? Of whether or not she wants to re-up her agreement, or where are we at with that. But again, I presume I'll be here for a while yet to help with those discussions.
She's on board for 2024 audit.
Yeah, so yeah, she's going to wrap the 23, next month maybe, and then maybe there's a little window where we can do some discussing and thinking before we have to crank up on the 24, because 24 would be nice if I could help us get that on some kind of schedule where it's done in June or something, but if we did get this thing done by September, that would be really quite quite something.
Well, I think there's certainly room and opportunity here. And Colleen talked to me on, what day is it? Wednesday. So it would have been the end of the day on Monday. So I got a little bit of this, not maybe some of the specifics, but I think there's certainly a role for her in her comments. where we want the finance committee, you guys, well, I think we figured that out, but maybe, I gotta follow up on what I showed yesterday and then talk with him and maybe we get a plan going here on, assessing where we're at, what needs to be done, succession. I mean, it's a big change. There's a lot to do here.
All right, so any questions on the finance 46? Like I said, there may be some significant revisions before we get to final budget, or perhaps this will suffice as placeholders so we have funding available. Yeah.
Yeah.
Next one I wanted to show, bear with me while I look at it a minute, make sure I got it done. I do. This is just our debt service department within the general fund, and this is where all our capital improvement bonds and the jail bonds are shown as an expenditure. This is the exact principle then from the amortization schedule, and interest on the bonded debt also includes the required 5% additional levy that's expected in the bond documents. So I plug that in there as well, so we got a number that covers all of it plus 5%. And then there's always ongoing bank fees associated with our debt. Basically, U.S. Bank will bill monthly for each of the different issues. That's how that's there, and this appears as our debt service levy for the county. It's on that. Nope. All right, then 124 also insurance. This is actually a designated or restricted fund, but it's part of the general fund. Similarly here, Colleen suggested that we don't do this reimbursement business that has been happening here. But it does work the same as the audit fund and has for quite a few years. We pay the entire principal for our workers' comp and property casualty. And we usually pay it in January, and it comes out here. It's about 6 something. There must be some add-ons here or other things, but yeah, it's yeah. This is more like the right number for the overall package, both packages combined, and then we get the information in terms of which buildings and how much work comp per fund, that kind of stuff, and then we dole that out and get reimbursed from whether it be the health fund or the road and bridge or the public safety fund. Then that comes back into 124, and so that's the way we've been handling it and budgeting it. Again, if she would prefer that it not happen and Chuck's okay with it, I mean, we can just starting at 25, then we can just dispense with the reimbursement stuff and get it coded directly to the appropriate fund on the way out the door.
Yeah, I need more from her on this because I told her how I thought we were doing it, which is when we started this. And she goes, yes, exactly. But I'm not sure that we're talking the same thing.
Maybe not. Yeah, we can go back over that. Yeah, so I mean, it works fine, but maybe it saves a little bit of accounting for them or something. It would actually make it a little bit trickier for me. But yeah, I don't think it's that hard to offset your expenditures with the refunds and reimbursements. Just take the one number and wipe out the other one so you're not overstating things.
Yeah.
But that is the thing. Like if you're overstating your revenues or you're overstating your expenditures by doing this kind of thing, and to me, I guess we are, unless you catch it before you do the audit.
Well, yeah, no, what she was saying is that we're showing things twice and it makes it look like there's more than there is. Okay, I understand that because, case in point, the audit discussion, you now see that as an expenditure in a different department, or revenue and runs. But we're trying to make sure that funds that have other sources other than the levy are paying. And it's the same with this.
Yeah. Precisely.
The other thing about this is when we started, or at least when I came here, we had some very large undesignated fund balances. It was general fund basically. And this was a way of, let's just take $500,000, we'll designate it as the fund balance for insurance, and then we'll work from that. Because we do get claims or deductibles to pay. So there's always a little bit of outs. Sometimes there's some ins. And then we distributed the share of each department in their budgets, move into here, pay the one bill from that fund. There's it's I don't want to say it's just the accounting, it's just how you track it. If she wants suggest we change it, I think we follow the lead of the auditor, but we have to make it happen and be able to make sure we're staying on top of what's actually going on. Fortunately, I haven't seen anything here like I saw in the previous county that I worked at, where a department's management was creating claims. And that's kind of my mindset when we started this. When it was at my jail in Wisconsin, had a huge claim. We ended up having to sell a bond to pay for the claim. So I made sure that showed up in his budget, the sheriff's budget every year, as a reminder. Listen to administration and do what you're supposed to do. Don't wing it. Otherwise, you're going to have this kind of problem. I'm not seeing anything like that here. So you come in with some scars from other places. But anyway, sorry, I digress.
Yeah. My only other thought is that I mean, I thought that the OSA, the other auditors would automatically offset the expenditure with the reimbursement so as to not overstate either.
Yeah.
But so perhaps we're going to make the audit a little simpler, a little less expensive or something marginally, and then do this differently. I'm good with it. Sounds like you're good with it. Mm-hmm. Next up, I guess I've also plugged numbers in what's called general revenue unallocated, which gathers in a whole bunch of different fees, including the property taxes, which we don't show here at budget time, but this is where they go. A lot of that stuff comes in. I'm going to say it comes into Sam's area, but perhaps I'm wrong about that. It comes into the front counter here. I think a lot of that stuff, like sales of atlases, and that's apparently miss. Oh yeah, the elephant in the room. I'm looking into this.
The bigger increase in earnings on investments.
Yeah, it's big, but I mean, I think it's right. But Heather's going to look into this and get me the actual detail. What I think our money market was actually making about 80 grand a year, 8 grand a month, just in our general money market throughout the year, because I had a lot of money. We had ARPA money, and we had a lot of money, and we
Right.
had quite a few million that was just sitting out there. Plus, I invested as rates were going up. I invested into some term investments, and this is cash basis. So I mean, I've described this once before to the board, to the committee, but
Mhm.
so then when they came due on a cash basis, we post a year and a half's worth of whatever it is. And I looked it over as again a cursory glance. It does look like, if you take the pieces, like, it might well be correct. Hopefully it's not a mistake, but if it is, we'll figure that out before the year is out here. And that's why that one is so extremely high. And I don't really know what to budget here. I've pushed it up now to 650. It's hard to know what the interest rates are going to do. I think they're going down a little today, later today or tomorrow. We're going to hear. And then, if I under budget it and we get more, I mean, I'm actually just helping the general revenue fund balance. And if I go the other way, I'm actually harming the general revenue fund balance a little bit. But I'm open to some suggestions or whatever on that. But right now, I think that looks like a decent target. Go ahead, Mr. Holm.
A question on the 1.8 on the 23. You were saying there was an increase in fund balance because of ARPA money and all those dollars.
Correct.
Plus the earnings off of all that money over approximately an 18-month period.
Yeah. We have
Gotcha.
additional beyond 12
Yep.
months. We have additional months of interest beyond the 12. And what I was kind of trying to say, and maybe I stumbled on a bit, was that interest rates were kind of on an increase for a while there.
Yep.
And that was making me go out and purchase some term investments instead of just leaving it in the money market where it was they were sort of declining, or the inverted yield curve. The rates out here were lower than, so that's what part of what I think we're seeing in the 23 number that we will continue to research, I guess, to make sure it's.
And then your 650 budgeted is going back to the normal fund balances and
Yeah.
and back to a 12-month estimation, correct?
Yeah.
Okay.
Yep, exactly.
Gotcha.
And yeah, it was capital improvement bonds, ARPA, and a lot of highway federal funds or whatever that made those numbers seem quite high in the overall balances.
Gotcha.
Okay.
Thank you.
Thank you. This little one, ditch interest, I mean, that's just a reminder, more or less, that we charge interest to the individual ditch entities that have negative cash balances. We use our general fund money to bring them to zero, and then we charge them interest. You know, similarly, though, we're paying out ditch interest to the. I obviously missed that line. We pay it out to the ones that have positive cash balances. Also get the same interest rate. Sorry, let's make a quick note. What else looks interesting here? Anything else? Seems like it needs explanation for you.
A big reduction in the workers' comp insurance.
I'll verify that too, Commissioner. What I put in the general revenue unallocated regarding these two insurances, the property casualty and the workers' comp, is the balance that's not budgeted in the other funds. Do you know what I mean? Like public health and all the others also have a line item for those items, and it should total to the 690 or whatever we're estimating for the overall package. So I'll just make a note to verify that, because it does definitely look to be 1/3 of the number from before. So I can't recall it off my head where I picked the 31, but it might be that we saw more in one of the other funds. Go ahead. I'm sorry.
I was questioning early public health on that payroll increase on the workers' comp, and then all the sub-accounts that had payroll listed, I noticed no workers' comp line items down there. And I've seen that in some of the budget here, there'll be a workers' comp deduct in one category and not in others. So
That would take a bit of work to allocate it to within. I think it would take a bit of work on their part to allocate it out in that fashion. I don't know exactly how they would do it in public health. They could make some kind of thing percentage-wise, weighted percentage-wise per staff. All we know is, like I was trying to describe earlier, is all we do know is that each of those individual positions in health, for example, has a unique code based on the type of duties they do and where they do them. And so we do get that information, so we could find out public health code 8810 is a clerical worker. We could then say you got this many dollars in clerical workers' comp for that year. So then but dispersing it beyond, I'm sorry.
And based on usage, maybe?
Yeah, it's based on actual, but it takes about 2 years for the actual to happen. At the end of each year, we will send in our actual data where they get all the pay by person and by category and by fund, and then they will do what they call their audit, the MCIT audit on workers' comp, and then they'll compare that to what I had given them for estimates, because they bill us based on estimates, and then they adjust to the actual with a little refund or additional billing. Like I think we got it a couple weeks ago. It was only $1,100 of adjustment on $18 million worth of salary. We must have guessed pretty close, but that was just luck, I guess. But I mean, so I'm sorry, I didn't get off on a tangent, but that's how we get, if they get it to actual. They bill us after the fact. We estimate, and then they'll create the bill, and then they'll get this audit thing going, and then they adjust.
I follow everything
Okay.
you said because
Okay.
I used to sit on the
Okay.
state workers' comp board back in the early 90s, but that's where I'm having a hard time seeing, and it's probably not in all this information, because I brought up 3 years ago about Social Security. The numbers weren't driving, and I've been paying attention through the whole process here. That seems to be more in line with the 7.65%. But the workers' comp, I'm just kind of losing it in all of the smoke, if you would. and I understand it's a workers' comp is a function of payroll.
Yeah.
And it's on a, like you're saying, that you don't get billed until the year end when the reports are sent in. And then there's also adjustments and so forth and so on. So I agree with you. It's on a 3-year cycle to get the true number, but I'm looking at the estimated and I'm just not, to me, it's not making sense, but a lot of things are over my head, so.
Here's here's what we actually get. I don't have this for the screen, but here, I'll give it to Ron to make sure that it's said right. This is what we actually get from the MCIT that we use for the budgeting.
I don't want to delay conversation here. It's just my simpleton calculations that
You might.
I'm not questioning. I'm just.
I think you're looking at it a little bit differently than we actually budget, but you're talking about post reconciling. For budgeting, we just use this with here's what each department share is estimated, and we put it in.
Yeah, and on the estimation, sometimes I see it, sometimes I don't in the numbers. So it's
You're more likely to see it in a closed actual. Those are actual numbers in 2023 versus the budget. 2024 is year to date. 2024 is the total budget. 2025 is so.
And it just on the FICA taxes, just quick calculation, some of it was very close to the 7.65%. Some of it, depending on the line item, was pushing 12. So is the workers' comp in the 12% or 13% based on the payroll, or,
The 12 is probably law enforcement because they don't pay Social Security. They pay.
But that's the differences I've noticed. So it's probably just the way it's gotten classified on the individual budgets. It's there. It's just doesn't stand out. I'm thinking.
Yeah, we could do a better job of summarizing what's going on with the
No,
workers' comp, and I think that.
I'm not asking for that. I'm
Maybe
just.
does need to get out to the departments for better budgeting, or maybe I can review that to see that the budget should be synced with what you have in your hand there. I believe reasonably well, right? And it may not be, but
I thought
don't
you
know
just
that
plug these in for each department.
I take something similar to that when we get the actual, and I charge them. So if we were looking at the actual column,
Well, it might be outcome markers.
and then social
Belaboring this.
Social security is on your overtime and everything. If you're throwing those numbers in the other pay, it's on all those buckets. So I mean,
Just general liability. Breakdown. Just go by.
Yep.
Yeah. That's why you're meeting.
That's what. But then he corrects it.
Yep.
You correct it as an actual, not the budget.
I put in the actuals. Yeah, I usually do it in like September, like this time of year is when I do that. That's why there's nothing. You've seen all the budgets pretty much now. There's nothing in their real insurance costs yet because it hasn't hit their bucket yet. But
Anything else? If not, we'll reconvene at 1 p.m.
Thank you.
So Levi Webster is up.
I might as well get going.
Sure, go ahead.
So first item here is just refunds, reimbursements. A lot of that comes from social services. That is up for 2025. That has to do a lot with hardware replacement. A little bit loud there. But we got quite a few buildings need switch replacements, which add on to that. Social services get some grant and state money, so they do a reimbursement, so that that number is up. Second item, of course, gross pay. That is a little bit higher than it would normally be for 2025, to the tune of about 25,000.
That's your salary, right?
That's
Your
salary.
full salary, is that?
Mine?
I'm kidding.
Mine? No, no. I mean, we could change it. But no,
I'm just kidding.
that's the whole department. There is a sheet in here with all the details. One thing I'll make note of. I'm sure a lot of you have worked with Joanne. Her plan is to retire at the end of 2025. So I do have 3 months of a replacement there to do some cross training and get them up to speed as well. So it's just trying to plan out the end of the year with her leaving. Other pay, that's going to be about the same. We also have overtime pay. Just with the nature of IT, we really are a 24/7 facility on a lot of things, law enforcement, jail. We calculate the overtime pay based on the number of calls we get throughout the year. So that's pulled out of Kronos. When we get a call, we mark it down, and that's where we get some of those average numbers from. Then we look at salary and then figure out kind of what the cost is on that.
You kind of use a percentage, or does it average out to be kind of a percentage for overtime, or do you actually go by actual?
It averages out. We kind of plan for the worst a little bit, depending on. A lot of times after hours, it's going to be an escalation. So maybe network admin or systems admin gets a call. A lot of times it gets escalated to myself or someone else, just depending on what it is. But yep, we just try to use the averages as much as we can, and then try to get as accurate as we can on that number. So
Well, that's pretty reasonable.
we try not to have the after hour calls. When we get a lot of those, we got bigger problems. So cafeteria benefits plan, kind of the same thing. It's up. Para, that's up a little bit, and Social Security. I have highlighted here under communications, phone and data. That is up. We've taken over the WAN services from social services. That was, I don't know why in the past they got kind of stuck with that, but that's coming back over to IT. We do bill them out a chunk because they are users on that. So we do get reimbursement off of that. But it's WAN services. That's our network with the state, so it makes sense to be back in IT.
You keep that postage way down there.
Yeah, we hardly ever use that.
$100.
Yep. Next item I want to point out is going to be the data processing. That's going to be a good chunk of our software. Now, a lot of that number is going to be the Microsoft licensing. I'll admit I come to you guys every year with that one. I hate that one. It gives me anxiety. It's a big number. That's all our server software. That's all of our a lot of our security software, email software. All of that falls under that item. You remove that item, and that number goes way down. But every employee, both here at the county and Tri-County, has licensing in that number. Professional services, that's just, we do get some additional assistance from time to time, a lot of times through Morris Electronics, but it's just, once in a while, us in IT, we just don't know. So we just need a little help here and there to keep us going. But that's what that is. Numbers up just a little bit. Some of that's going to be for just the increase is going to be for some additional like website services, things like that. A lot of that falls under ADA compliance, making sure that folks can view things properly. Then lease agreements, I got a big zero there this year. That is for our server hardware, the actual physical hardware. Kind of good news, bad news are we're done paying the lease, but we had to do some additional support and maintenance, just so if we have failure, we can get replacement parts, that type of thing. That's been added actually under our equipment, and I believe it's the equipment and machinery. So it's still there. It's just been moved to a different account. It's just something to be aware of. I was all excited that was gone this year, and then we dig around and get quotes for the maintenance on it, and it's, well, they could have just kept going with the lease. So
Short-lived excitement.
yeah. And a lot of these smaller things, they're kind of relatively unchanged, whether that be supplies, books, fuel. Now, the big one I want to point out is the repair, maintenance, and operations. Typically, we have $300. That's for some car maintenance. It's way up. So what we have, and I did highlight it in here as well, we have 4 buildings that have outdated hardware for the door access system. Just something to be aware of. I went through the process with JCI to get proposals to replace door controller panels in the East Grand Forks building, the Law Enforcement Center, Justice Center, Highway building, and then I also included the JCI Secure contract. It's just, you think it's odd, but when a door doesn't work, IT gets called, and I just don't want us to run into an issue where we can't get the parts that are currently there. So it's either we kind of plan for it, or else we deal with it when it breaks. It's more of a break fix. But the best example I have is a power supply blew up in the Justice Center, and it took, I think, a week or two just to get a power supply to power some of that stuff back up. A lot of that's just planning, making sure that just those 4 buildings are functioning as needed. And then kind of the last one there, we have kind of a big jump in the equipment and machinery, the capital. A lot of that comes up with hardware switch replacements. That's going to be, every computer, every access point. Gosh, I hate to even say it, doors, all that stuff plugs into that equipment. That's kind of the backbone. But we do have, I think it's 4 locations that are due for replacement on some of those items. So.
But can I ask a question?
Mm-hmm.
So on some of these equipment and repairs and maintenance, I'm just going back to, if we build a new building at the highway department in the 2 places, some of that's going to get combined in, because we're not going to duplicate, right? We're going to try to nurse it along.
Correct. Yeah.
Right, until we make the switch, right?
Yep.
Just asking. I mean, that's kind of a dumb question, but I mean, the common sense thing was we're going to update it all when we get the new building. We're going to
Are we getting a new highway?
Well, we don't know that.
I'll just announce it.
Not next year.
Not next year. all I'm
Okay,
saying.
okay. Yeah,
Thinking
that's
about it next year.
and that's one of those things too. Something like that can be moved. So
Okay,
Yep.
okay, that's
Yep.
where I'm getting at.
yep, it's not just a throwaway. It would just be moved.
That's
or
what I'm
however,
getting at.
however that works.
Just
So,
don't
yep.
want to do something, What if we do something new?
Yep.
We're not gonna just toss and burn.
No, I've been here for a few years. We have a tough time getting rid of things already, the way it is. So yep. So it won't
Just
just be
asking.
tossed. So any other
At these
questions?
prices, we don't want to just.
Yeah.
If it can be salvaged, we'll salvage it.
All right.
Yep.
Good.
In fact, you asked me last week, if there's a better way of getting rid of computers.
Yeah.
Do we want to share that conversation? It was kind of a minor thing, but I mean, as many computers as we have.
Well, and I think Mark maybe mentioned it to Joanne. If it's possible to purchase a computer after end of life. Yeah, we discussed we could do something where it goes to auction, just a simple auction sheet. Hey, here's what's available, and then it'd be available for the public or whoever. They can just sign the sheet, and it closes at this day at that time, and whoever has that bid would win the item or get the item. So
What are you doing now?
they get recycled. Yep.
Okay.
Yep.
We get nothing for it.
Nothing for it. Yep.
Right. I mean, you have to pay for it.
What's that?
Steiner maybe gets some money out of the recycling.
Yeah. It's Steiner's cashing in, but
Yeah.
Okay.
My county in Wisconsin did this. You just wipe the drive clean. I don't even think they put software on it. They just wipe it clean. They put it on a table in the entryway, right here, with a bid sheet. You just put your phone number on it and your amount. Everybody can see it. And the deadline is
Just like a silent auction.
Yep.
Yeah.
Yep. It'd be just kind of sold as is.
But you'd include the entire public, not just the employees. That
Correct.
Right?
It would have
That's
to
what I
be the
heard you
entire.
Understand what you were saying.
You don't put 12 of them out there. You put maybe 2 at a time. So there's always a little demand. And people will give you $100 for an old computer and take it away for you. And they have to spend some time.
I was going to say, as long as it doesn't take you a couple of hours a day or something.
Yeah. No, it would. They have to
Do it online, maybe.
be wiped, I suppose, to
Yeah.
DoD standards, and then they'd be free. So.
We have multiple buildings. You could just put these things out.
Mm-hmm.
Won't get rid of all of them because we have an awful lot of computers, but you might get rid of a lot of them.
Yep.
Make a little money out of
Believe
it.
me, there's a lot of people out there. There's a lot of 501Cs that always are looking for donations too.
Yep.
Better than putting in a landfill.
Yeah, it's unfortunately, it's just kind of e-waste after a point. But yeah, it might be another
Yeah.
use for it. So
Yeah, come up with a plan.
okay.
Then Mark can bid on it. Start seeing commissioners one at a time walking out, coming back in.
They just keep walking back and forth.
Just bring a chair and sit out there.
Just don't do it during election season. But yeah, no.
Let Sam take those during when people come in to vote. They could take a look at the equipment over. And
Yeah.
maybe not.
Your vote is private, but your bid is not.
Yep.
I think one of the things I said with the board and said it again with Levi here is that the system security just simply has to be one of the top priorities that we've got in the organization, and anything we can do to improve it. Too many counties around us have gotten attacked. We get attacked, but we're able to fend them off.
Yeah, we're constantly seeing brute force attacks on whether it be our VPN gateway. We got that public GIS map things like that. We are monitoring all that. We do watch it. But yeah, no, we see the same things other counties do in the state. So yep.
Well, I don't think you should have anxiety over the 345,000. You shouldn't have to have that anxiety. That's just the way life is in this world.
Well, there's some things, that we do. I mean, there's a lot of backups that go on, but there's also some things like what Sam's got for voting that doesn't touch the internet.
Nope.
We just keep it off it altogether, self-contained, so it can't be part of those kind of attacks. You all see what goes on in the world and read the news, and we're right there too.
Yeah, I mean, I was busy rolling out multi-factor authentication at the attorney's department on Monday. That's just to log on to the computer. So it's, yeah, it's just the world we live in.
So you'll have to continue to change your password every 3 months. Annoying as it is.
I've only opened it once. I'm gonna have to change the password again. Crap.
Sarah says that she doesn't even maintain a password. She just goes forget password. They send her a new one. She uses that one until the next time. Does it again. I don't know if that's the way to do it, but
So secure, she doesn't even know what it is. So
seems to me anybody could do that.
I think we all have a couple accounts like that. So
And out on the intranet, you can see the list of bad passwords to use. And
Yeah.
there's it's interesting to see. You think you think you might be creative coming up? No, somebody else has already come up with that one.
yep. That's something too we might look into is we can tie back into some of these databases with that info, and if you're resetting your password, it'll actually do a reference and oh nope, you can't use that. That's kind of one that's known in a breach. So that's another item we're thinking about. So
Yeah, or it doesn't meet the criteria.
yep.
And I'm trying to remember. So what did I type in?
I always use big long phrases now. So
Yeah, that's actually good.
Yeah.
yep.
I can't remember.
That'd be a great password.
It's on the list, I think.
Yep, it is.
Some people use the word incorrect.
Yep.
So if they put something in there, the password comes up and says, "I'm sorry, your password is incorrect." And you go, "Oh yeah, incorrect, of course."
Let's see if
I wouldn't have thought of that.
That's one not to use.
Don't.
Yeah, someone's using that one. Someone's using that one already.
Well, that's just it. I mean, we can't see that. So I always chuckle at the folks that tell me they just changed the number at the end. So
shouldn't do that.
what's that?
I shouldn't do that.
Nope.
She has a number.
Anything else? Levi, questions?
No, any questions? I mean, it's fairly similar to last year. The big item was that those door controllers. I just don't want them to get forgotten about. But other than that, I mean, a lot of things are 5-10% increase. So
Excuse me.
I've notified Rick he can come early if he can.
No further questions?
No.
Okay, well, let's move on.
thank you.
Thanks, Levi.
Thank you, Levi. Look at that. To make sure.
What are coworkers for, huh?
You want to talk a little as we wait for Rick here? Because I'm not sure he's seeing my email. You want to talk a little preliminary
Sure.
levy and other things? I don't know if there's a way of Tim. go into the packet to call up a couple of things?
Do you need me to? I'll be looking for these two items. Okay. You want me to? Well, can I open them or? Yeah. You already closed.
My downloads?
That thing?
I don't know where my download. Yeah, there is.
How do you keep up typing fast? Here was your. What's your date? Ashley has it all pretty well laid out for me. Yeah. Where is Judy?
There you go.
She does. Very much. There you go.
Yeah. Can I have those?
Yep.
If I could, this will be my fourth request, I believe, third or fourth, on the assessed value calculation for budget purposes. Can I get that number?
Was that not sent to you from Mark?
Nope.
I believe he sent it to all commissioners.
Yeah,
Nope.
we've got
I,
it.
I never got it.
Then something needs to be checked on your email, because I know he sent it to
Mhm.
your county email a while ago.
Mark Landsberg.
Yeah.
Mhm.
Let me find it now.
never,
You want me to send it to your home email?
We'll
Or
see if
both.
Paul's got it.
Send it to both.
Do you want to send it to me right now?
I don't have it either.
You want to send it to me right now, and I'll call it up.
I check mine all the time.
You had it, Joan?
Mhm.
And he listed it as, the spreadsheet is titled Strando Valuation Report Calculation. But it's comparing the 2023, 2024 countywide valuations and the percentage that each property type composes of the total value within the county. It was sent on September 3rd.
I got it. We got it too.
Then we must not be knowing what we're looking at.
Mark, I'm going to forward it to both those emails as well.
Thank you.
Sam, are you in a position of explaining this?
Let me open it on mine just so I can see it a little bit better.
Who did it come from?
Mark Landsberg.
Sure.
Evaluation report. Okay.
You got yours. All right.
Yep. So on the top, that's giving the total estimated market value in the county. The 2023 assessment, which would have been for the 24 taxes, was at the $7,423,890,600. And you can see in the 24 assessment for the 25 taxes that it's gone up to that $8,529,501,000. Then the difference and the percent change. And see the net improvements. I'm guessing that would be the change in buildings over the year, the estimated market value on buildings for that. And then below that, the agricultural market value of tillable land, what that has changed. You know, are there any questions on the descriptions of each of them that?
Now I understand what I'm reading.
So that 14.9% increase, that's the highest since I've been around.
And we're not done yet. We go one more year.
Well, the next assessment will be 2025. The 2024 values are what the 2025 levy is based on.
Yep.
Is there I think what I got last year, was there all properties? Or just this one?
All property classification is on the bottom.
On the bottom.
Okay.
Well, that's all other property classifications. Do you want everything combined as far as, because that total at the top is the entire county of all properties.
Yep. 4.6.
That's all other.
Yeah, that's the all other.
This is the number you've been asking about up here,
Mm-hmm.
Mark.
Yeah, the top one is the overall for the entire county, all the property.
I have to think some of that is due to inflation, but that's still a good number.
Mm-hmm. Yeah, they cut the rate by 0.5%. Yeah, so.
But that's because inflation's already come down. Cutting it will raise inflation.
Now, and they lowered the interest rate by 0.5% here this afternoon.
Right, that's, yeah.
How much? 0.5%?
0.5%.
But these numbers don't reflect
that.
This is 2 years ago sales activity reflected in these numbers.
Right. But we've had the inflation going on for a couple of years.
But I guess it makes more sense.
No.
Now you're gonna have more.
Stupidity in purchasing.
I choose not to view our constituents that way, but I'm not the one up for election.
Yeah, you won't see any effect
Till after next year.
Yeah.
It's
Thank you. That's awesome. That helps. That's helpful.
What this is going to suggest is that our tax rate is going to decrease. So it's not actually called tax rate, but what you're used to calling it, what I'm used to calling it, tax rate will likely go down if we can get the levy down to the areas that we've had it in the past.
Good.
And you had mentioned to us before that it was a minus 3.9%. You have told us that before, I think.
And the
House in 1 acre.
For the agricultural.
Yeah.
Quite possibly. Mark might have brought that up as well. Something that if Mark Lanzer addressed it at the County Board of Appeals.
Yes, I think you're right.
Yeah. As a percentage of the total,
yeah,
that's relatively small.
Mm-hmm.
I don't have the data handy, but I think I did send it to you that the demographers' population estimates however show that we're going down as a county. So I don't know how all these things tie together, but land usually goes up. Anything else you want to look at here? Does this answer what you were looking for?
Yep.
Okay. Should be in your email box. I stamped this draft, as you can tell, and usually I show this what a levy might look like as you go into next week looking at preliminary levy, and current levy is $27,570,000. So just using round numbers like a $28 million levy, a $28.5 million levy, $29 million levy, and then I did a 29.5. Just seeing what that $500,000 on the levy changes. Then I fixed a solid 6%, which is my recommendation as of today, simply because I don't know how contracts are going to end. But your history has been to be in the 5% range. You get a bit of an idea of what those numbers look like.
Last year we were at 3.9999.
For the levy increase.
Right.
Um,
Not to exceed.
Oh, for the preliminary levy?
Prelim, yeah, prelim.
Let me call this up. Can you get in there? Because
I think that's what our prelim was.
let's see. See why we're on this. I showed you this a couple weeks ago. So we kind of get into this, we call it the net levy, add county program aid to it for the gross levy, since program aid is meant to reduce your dependence on the levy. But the actual levy increase is based on these net numbers. So last year's preliminary was 4. That might be rounded from what you said, Gary. I can't remember, to be honest. But
3.999.
Yeah, that's what we were.
yeah, but we ended up at 2.5.
Yep.
I go back far enough, 2009, a few years before I got here, to give you an average increase, about just under 2.5%. Some of those were pretty low, but really since 2015, you've been 3, 3, 3, 3, 2, 3, 3, 2. And we're always able to do it, but there's no secret. I use a lot of fund balance and some cuts, but a lot of it is use of fund balance because, as you saw yesterday with social services, we end up having a lot of fund balance, which
Right on
helps at this
schedule.
point.
1:30.
To me, it's kind of a message about how precise or lack of precision we're able to throw into our budget making, but you're only going to get so close anyway. And some budgets, like social services, can be very difficult with the lag in revenues to expenses. And the last few years have been strange when state and federal government are essentially sending you checks to use for various things, and you're like, okay, we're not even ready, but we'll try to follow your guidelines and get the money out. We still have some of that money. So that's the history.
On the preliminary levy, I would like to see, because you're estimating, according to budget, or estimated budget, 27.5 was the.
No, the current levy for the 2024 budget is 27.5 million.
What is the actual number for the proposed?
It's not a real number as far as I'm concerned at this point, because I haven't done any. I mean, it would be a 30+% increase. Well, it's not even worth putting on the board. I've done nothing to reduce, cut, because so much depends on wages. Going through yesterday and today, you can see, I want to call it the low-hanging fruit, but the things that have been put in there as reminders, the things that are capital, the things that you have some choices on. And there's usually refinement of almost every number. I talk to Ron on the revenues, what do you think about this? What do you think about that? What it means on September 18th may look different on November 18th. Particularly as you're getting down there and you're just trying to get to the last, you're just trying to take some things off the board so you know what you're dealing with and get down to the last few items that you're going to make changes on. and your choices get clearer as you go. It just seems muddled at this point. What you needed to do these 2 days is just be aware of what everybody's coming in at, and I think you've got that. And honestly, for this year, for 2025 budget, no department is coming in saying, maybe Rich with a new building, but I think that's a reminder that we should look at this at some point. But, when you're in a contract year, you just have to kind of have an idea where that's going to end up. And I think I've shared where that appears to be going.
For the preliminary percentage, we have to set that on Tuesday, correct?
Mhm.
And then the final December 3rd.
Before the 3rd, I think.
No.
Isn't it? Or after the 3rd.
The
That's what it is.
The public hearing on the budget and the notices that go to everybody for that hearing will be based on this decision on the preliminary levy, along with all the other jurisdictions that have a levy. By the time we get to December 3rd's public hearing, board, myself, pretty much know what the final decisions are on the budget. Likely by then you know what the actual levy should be. So you can say at the meeting it's going to be 3.2% or whatever. That won't show up in anything that gets sent to anybody. It'll just be whatever this number is. But as always happens, people rarely come in on the budget, they come in on their evaluation. So we spend the evening working on that. Sometimes the concern is how that affects them on the levy. Makes sense. You've been through it. But the objective is to try to have a levy that pays for things, doesn't hurt taxpayers. They're not going up, not going down. They're not getting whipsawed by what we're doing. They might by other jurisdictions, but not by the county.
The 17th is probably
when we set the
17th is the
final.
It is.
Okay, public hearing on the 3rd.
Yeah.
Final setting
17th.
17th. Okay, gotcha.
17th
December.
Of December. And then your cities and school boards, they have different dates, but they
It's all about
similar
the
around
same.
that time.
Everybody's supposed to do it before the end of December.
And theoretically, it's an opportunity for people to come in and say, no, I think this is ridiculous in this area. We don't need this or don't need that. Or
And we're prepared from a staff standpoint, Sam's staff, to work with people on their evaluation questions. Sometimes there's actually something we can do other than say come back in April or go to your township or whatever.
As far as that preliminary levy, I could set that right about now, based on history. We've only looked at about 5% for several years and work it down to something a little bit better.
so you're thinking option 3? I mean, not that we're going to set it today, but
Well,
discussing it,
That's kind of, I don't know.
history.
I didn't see Chuck jump up and down screaming when I said that.
No, I said 6 just because it gives more
Before you
latitude,
came,
but,
he said 6.
Did he say 6?
He said 6.
but I also said you typically do 5,
Okay.
Correct.
which, I mean, I live with it either way, but like I said, in the end, we're talking generally fund balance unless you're ready to make changes to something you've seen or what we do.
Well, over the past 2 days, I've heard a lot of requests, capital requests, and I keep saying that fund balance, social services, can apply for a lot of that stuff.
Yeah, I've kind of said that too. I'll, in all likelihood, I'll be coming at you with use of social service fund balance just straight up against their levy request because they don't have any capital. And that's one way of dealing with it. The other departments, it's workable within their fund balance, but I have this sheet that Ron gave me, and I don't see it in the packet today, and I may have missed that, having been in the AMC conference last week, but we can go over this next Tuesday as well as to where our cash is all sitting.
We have some grant money in law enforcement,
Yes, we do.
and
Is
they had quite a bit of capital.
$602,000.
I
We
mean,
haven't
that
done
could
anything
take,
with
yeah, that could take care of a lot of the requests
The
that the
radios and
sheriff
that kind
had,
of stuff.
and
No,
guns, and
what it's there for.
No,
I think we should certainly spend that.
Yep.
And then sounds like our investments, you'll have a figure on our investments were significant.
Yeah, we might want to put together like a report or something like that on that, just how it's gone. See where we're going. That's all. That's not a bad thing to do about this time of year. I remember last time we looked at that.
And then we have our amount on community aid, I think already. And that
County
was an
program aid,
increase.
yep.
Program aid, I don't know what, I forget
It's up a
how
little
many
bit over
dollars.
last year.
I thought I had it in my notebook, but I must have it at home.
Did you show the MCIP dividend anywhere?
Not anywhere yet, usually during that last conversation,
Yeah.
put it in general, because it has, always leave out the option to put it in that restricted.
Yeah, so
Yeah.
for
Joan's got it here.
here, CPA, 1.996875.
So how much more is that than last year?
It's not. It's
That
up.
tells me a little bit more than.
Yeah, I'll get it right here. It's up. Well, actually, I don't have it. No, I do have it. I
Yeah,
go
with
back to
your
this thing.
other
2024.
You had some 25 things on there.
This is the number right there for.
Yep.
About 100,000, 110.
Yeah, it might even be a little bit more.
About 110,000.
Yeah.
Okay. So that helps.
Everything sounds really good there. I'm a little bit concerned with next year and the next year with the addition of the healthcare and that going up
going
to
out.
2 years, okay? And just like I said last year, I have no problem where we set that temporary. I don't, but I don't believe in deception. If we're gonna set it at 5, that's where I want. I don't want to change because I don't believe in deceiving public. If we're gonna set it at 4, then leave it at 4. That's how I think. I don't think if we're gonna set it at 4, if we're gonna set it at 5, then we work with that and make our changes, make our adjustments, but we don't have to change that temporary levy. We're telling the people, we're working with this. This is our number. Yeah, it is prudent to try to come in less, but let's don't set the temporary up here with hopes that we come here. Why not set it where we think we can make it work here?
Well, the 5%, basically, if you get it down another 1.5 from that, 3.5, that's about as good as you can probably ever do. But 5, it still allows you, if you can't get it down, you could live with the 5.
But what I'm saying is, if we set it at 5, let's do our best to get everything else down there, and then it doesn't really matter to me if we change it less. I don't like deception. I got a problem with this levy thing. Telling somebody we're going to start with 5 and work our way to 2 or 3 or 4. If we're going to go for 3.5, then let's go at 3.5. That's just the way I think. If we're gonna go at 5, let's leave it at 5 and work our best. Do everything else. Make our cuts, make our everything. Still leave it at 5. And I don't know if that's prudent or not. I'm just
Well,
saying.
Well, a part of the difficulty this year, I think, is because we don't know what our personnel is going to
Exactly.
be, and that's
Exactly.
70% of our budget.
Exactly.
So, and we're not going to know that in a week.
No.
We have to set that. So I would prefer to have a margin, at least this year, where the uncertainties are not there.
Right.
And time limit now,
Mhm.
you know, is an
But
issue.
Chuck is asking for 6 or 5. My brain says, I don't have a problem with either one of those.
Well, I wouldn't characterize it as deception at all. I think we're very upfront in saying there's still 3 months to go on working the budget.
Absolutely.
If the budget was done today, yeah, but it's clearly not, and it isn't going to be because we got contracts. By Tuesday, we will have 4 more negotiation sessions with 4 more groups. There'll be one group left that's coming after next Tuesday, but we don't know with these 4 where we're going to end up.
Right. And we don't want to give them any ammunition, so to speak, on negotiating power.
Are you suggesting we're going to deceive them?
No, we're not deceiving anybody.
We're just trying to do the job
that we are intended here to do. Exactly.
But I don't. Well, I won't say it's. I don't think it's deception to say we're not done with the budget, so
Correct.
we're still working on
We're
it.
still working on it.
Like I say, no matter what you put in for a preliminary levy, most people come in on a totally different issue, which is their valuations at the public hearing.
Exactly.
But I think some of the, I'll call it success, but the board's view in historically has been you're still representing your constituents and you have an idea where you want to end up. We all talk about trying to get to 3%. But as you can see, we've had some years more and less. Some things come up that either we didn't see or we find something that we can do more, because we don't really stop working on the budget up until about an hour before the final vote, because you just don't know everything. I mean, we had the one year we had the public hearing, we had the preliminary, we had everything all set, and then we found out that we left $600,000 worth of bond payments or expenses out of the budget, and basically.
And you gotta adjust for that.
Well, we did, and we made it fit. But you just don't always know.
True.
But it's not an attempt to deceive.
I think Markson.
Thing that concerns me, and it's going back to and I understand the budget and I understand the payroll aspect of it and not knowing where the final is going to end up being and so forth and so on, and I relate it to my own farm budget. If I know the price of wheat is going to be $25, it makes the whole budget process much easier. But if I've got to adjust my price of wheat to $5 and my fertilizer, chemicals, and labor costs and all of the incidentals don't change, something's got to change. And I understand how governments work and the budget process, but we just saw up on the previous screen on the assessed value $1 billion of increased assessed value, which comes into, by the time
part of the formula,
everybody gets done shaking it out, it's $1 billion of property value that all the expense gets spread across. And I've spoken about it before. What happens to this budget? What happens to the county if that billion wasn't there this year and whatever it was last year? I forget what it was last year or even the year before. What's going to happen to the budgets 3 and 4 years down the road when we don't see that property value increase and medical insurance is going up 14, 15%, and salaries are automatically going up 3 to 6%. Our constituents are going to be looking at some significant tax increases to make the budget. And I get it at the end of the discussion. We got it, like Chuck said, it all kind of works out because we're basically getting $25 wheat, which it's very easy to make the number. Even a poor farmer can farm well with $25 wheat. That's my concern as we go through the budget process is, and no, you can't budget for doomsday, but we've seen such a significant increase in residential properties, lakes, and agricultural lands, just bare land, 24.2% increase in assessed values. And that's based on sales activities. I get it, but we're going to come to that time period where it's going to be negative or zero. And what's going to happen to the budget then? Both on how we spread the assessment and so forth and so on, because cost of doing business for the county is not going to go down. It's only going to go up unless there's some significant changes. And I'm not advocating for change today, but I hate to be a devil's advocate. I think we got to start looking down the road of, okay, we've been on a gravy train here. Costs are going up. What happens when the assessed values start going down and costs are up here? And that's every governmental unit, school boards, everybody. I'm quite concerned going forward.
One thing, and we start making cuts to keep your budget down. If you push things down the road, then you get in big trouble because then when you really have to address them, they cost far more than when you first were thinking about them. So I'm afraid of that you do. I don't know. You have to try to find a way to make things work. And you know that bond issues have been the way for a lot of that to happen. But I don't know that there's any easy answer. But I'm afraid that if you just keep delaying things, you're going to get in more trouble then.
I'm glad you brought this up based on your background. And I say this as somebody who's been other places. I've never lived or worked in a place that has a more stable economic environment than Northwest Minnesota. I grew up in the Twin Cities. I worked in St. Croix County, Wisconsin, which was a massive growth. Our population, our valuations were going sky high until 2008, when that financial crisis hit. We went from number one in terms of growth for both valuation and population to 71 in a 72 county state. It'll bounce back up right after that because the whole economy was predicated on residential growth, which is what was going on there. Here, you got prime farmland, you've got crops that are well supported in Washington and probably the state, I don't know. People here know what they're doing. I don't see the wild swings I saw when I was in Wisconsin. I don't see anything like what I saw when I worked in Maine. which was crazy, but that's 30 years, 35 years ago. What you're seeing here from 2004 is that valuation to levy rate. It's not 1-to-1 because the way Minnesota does stuff with tax capacity and everything, but when this goes down, it means that valuations are going up more than the levies are going up. But I always caution the board that I think we have mostly the same people paying taxes every year. It's not like 25% turnover and new people coming in paying taxes and a bunch of people leaving. There's some of that, but it's pretty much the same ones, and it's probably a lot of guys like you, farmers.
But at the same token, if people don't pay their taxes,
right,
they lose their property. and I know what's going on in the farm economy. It's especially this year. It's tough. Wheat, soybeans, corn are not profitable, and we're going to go into a period of time here where the forecast is for the next 5 years to be tanking, if not severely tanking. American Crystal's been good the last 2 years, but they're projecting also there to be dropping off. You're going to see land sales dropping off significantly because the last list I saw of some of the high-priced farmland in my area was investors. It wasn't farmer to farmer. It was investors. And I think Gene Tiedemann was in here kind of making the comments not too long ago about, I'll gladly sell. Find me that guy who will pay that. They're not out there farmer to farmer. And that's my concern is, and you're right, it's relatively stable, but we've never seen this escalation in lake values or farmland values doing what it's done in the last 4 or 5 years. And that's, to me, the scary part.
At least it's going the right direction. Far be it from me, a career government bureaucrat, to be talking about how good it is. My end point was, I think the boards that I've been working for since coming here, let's be reliable, let's be steady, so that we can deal with the swings. Because if we suddenly have a crash, it isn't like our services go away, they're actually needed more. And that's kind of a reality of why we're here. And we saw some of that through the pandemic. Get this money out. Get this money into the community. Here it's coming from Washington. It's coming from St. Paul. Do something to get the money out. Keep things moving. Suddenly that's our job. Well, it was for a couple of years.
Yeah.
And, that's kind of worked its way through. And, inflation has been some of the residue of that. And I suspect that may play into this. But again, I'm not an economist. I'm just trying to make sense of it like everybody else. But the consistent part has been, let's just try to be consistent, reliable, meet the needs, not have big swings up or down. And I think you've been doing that. And, we know that jail bond levy is going off. So, I mean, that's starting to have actual impact on some of the decisions that have been made. And going back to our contract negotiations, that kind of fits with some of that.
The timing of that is good.
Well, it's been coming. And, now the idea of building a public works garage or highway building, a lot of that's going to come down to what's the source of the funds. Because there's ways of doing much of that without just going straight to the levy. But we're going to have to really study that and look at it and get some advice and, but.
Yeah, that's years down the road yet.
Yeah. If interest rates are coming down again, it gets easier to do because that present value of money going out. we've, I think, scored on that a few times.
Well, Richard's here at 2:00, so maybe we could bring him up and then finish this discussion after that. And we'll get some more information on how much money we're gonna have to bring in. Facilities are,
Like Bart said, everything's going up.
you're the last person though, so I'm not sure if we have any for you, but
Have anything left?
we'll listen to you, that's for sure.
Yes, there's always retirement.
Oh, geez.
So does my banker listen to me.
Always retirement.
Yeah.
Okay, where do you want to start?
Okay.
Page 1.
What's that?
Page 1. Yeah. All right, page 1, everybody.
Well, obviously, I mean, we're going to be needing to spend a little more money to keep the place, keep everything running. I mean,
Sure.
just everything's going up. Tried to keep everything as tight as we could. As far as we look at projects and whatnot, we still have some bond monies left for a few projects.
Okay.
And but we're kind of backing off on that too. So, you know, we had looked at doing this big project here for the government center.
Mhm.
They just got too far out there. Money's, every time we talk to them, would go up 100,000. So we just realized that this is one thing that we can sit on for a while. And who knows, you know, there might be grants later on and energy credits and whatnot.
Excuse me. I need my coffee.
He's gonna cuff me there. Anyway, so I don't.
So that's kind of on hold.
Yeah, that's going to be on hold. I mean, I did leave it in for 2-3 years down the road.
Okay.
For capital improvements, just to have it in a plan. But for this go around and next year, I think we got other things that are more important to look at doing. No really big surprises that I saw. I mean, you know, our energy, of course, that's always the one that's up in the air.
Yeah.
And so that'd be the most volatile of anything. We've been holding pretty good. So, you know, we're trying to be more efficient in everything we do too. We're trying to hold the line there. Repairs and maintenance and whatnot. We've been trying to stay on track with that. And you know, you gotta keep what you have in good shape. Otherwise, you're playing catch up. We don't want to be doing that. That's too costly. As far as let's see, nothing that, unless there's something that pops out to you guys, there's nothing there that's really out of the ordinary. And obviously line items, building by building, nothing crazy. We're showing the 3 bond projects that we would like to move forward with. Would be at there's one of them here at the Gov Center, which would be caulking, all the exterior caulking of the building, for weatherization. We're in a position where we need to get that addressed, and that was $56,400 right there, and I would like to use the bond for that. The other bond items would be if we go to 198. Our water heater system for the jail is in need of upgrading, and that one, that price there, that $288,750 would take care of that project. And then the other thing we're looking at would be $80,000 for lighting upgrade retrofits. Those are the 2 items that'll give us the biggest payback
That would also be for the jail.
those would be for the jail. And that'd be mostly for the jail, but like on the hot water system would be all for the jail.
Right.
The lighting, that would be probably a little bit between the 197, mostly 198. 197 would be the rest of the Justice Center. I mean, if there comes a few areas where, hey, we really should do it. I mean, we're in the same building, and it'd be just a matter of making an adjustment there.
Okay. And was there some issue with the juvenile? Some repair there that needed to be addressed, or am I thinking of something else?
The juvenile, we're pretty much up to speed on that. I mean, well, there's an additional cost in there for that chiller that we put in.
Yeah, the chiller.
There's
that about?
It's a 3,000. There's to put it on the contract. That's where that would come in. That'd be an annual addition to our contracts.
Okay.
Our maintenance contracts. That $3,000. Yeah, good catch. So you do read this stuff.
Occasionally when I'm bored.
What's that, Rob?
The other big one is LEC 190, but it actually looks like you dropped it a bit.
Right. The LEC, I mean, we've got miscellaneous things over there that need to be done, doors and whatnot, and it's kind of been put on the back burner until we get these other things done. So hopefully we might be long on that one, which we'll need to make up for the rest of them. And one thing I've seen that's been a little bit crazier is our water bills have been going up, and almost doubled on a couple of buildings, and really can't seem to find what the reason.
It's city water though, right?
Yeah,
because they've raised their rates and sewer
substantially.
Yes.
Yeah. I think for the Justice Center and jail, and also for this building, it almost doubled. Now, of course,
double check, but I think that's would be part of it.
Mm-hmm, mm-hmm. Well, the thing is, I mean, we call it a water bill, but you're paying for sewage and services and all those other good things that they throw in there.
That's true.
You buy a drop of water and then you gotta pay to get rid of it too.
You have to drink more.
For every drop you take, you
get to pay more.
There was one in the beginning, on the first page that you were up there.
First page, sir?
Yeah, first page.
On the generals?
Yeah, on the generals. 22,000.
22,000.
Come on down. Right there. I just wanted to see repair and maintenance. Yes, from 69 to 22,000. What happened there?
Basically, there again, we've got some. I took our expenses at for the year to date, which was at 4,500. I basically, this was a half a year's when I did the work on it, so I doubled that, added 5%, and I know we have some things coming up, so that's why I threw the extra. There's about an extra. Well, see, that'd be about $10,000 in there.
Well, I think also some of that was because of merging accounts.
And then we merged accounts. Good point. That was in my notes here too. Yeah, we merged a number of those miscellaneous accounts, and that's where these things are going to show up too.
Okay. All right.
How many employees do you have?
We got 11. Josh, you keep track of that?
13 with us. The whole department.
I think you said maybe 2 retirements coming up.
We got 2 retirements coming up, and currently we just replaced one of our resignations, excuse me, with that lead custodian.
Okay.
So we'd be looking at replacing that custodian. I don't know if we're gonna really rush into that right away. We're gonna kind of see how things work out a little bit here.
Yeah.
You know, I mean, if for some reason it doesn't work for her, I'm sure she'd want her old job back.
Yeah.
And so we'll just kind of coast on this one a little bit and see where we end up.
Well, that's
Thanks.
Any red flags for you, Ron?
Can't think of anything. Would you like me to call up just the bonds so we can just verify what's going on with those?
Yeah, that
yeah.
wouldn't
See
be
how
a
much
bad
money
idea.
we've got left there, and
Okay.
Hopefully we brought that number. So I can do what's left, but I don't. What I was about to do is something a little different. It'll just take a second. Yeah.
I'll just gonna step in on, I met with Rick and Josh on Monday just to kind of go through some of the bond stuff. I think I told you some of this yesterday, but trying not to throw the kitchen sink into what's left and spend it out, but keep what we're doing at a relatively high level. These are things that should be done generally in the over $50,000 type range. Try to incorporate into the operating budget these lesser amounts. Use up what we need of the bond, but what's left over, perhaps use that to help pay off the bond itself. We're getting a little away from what we sold the bond for. And at some point, I kind of need to go back and double check, see how close we are to the original intent. But I don't want to just spend a lot of time trying to find things to use that money on.
no.
And these guys were good. They showed me some things that we can modify. So
I could just give you a little bit of a
What do you got?
recap there. We have one project left to do this year, which is at the LEC. It's that main breaker panel. That's a $70,000 project that was already on the bond for this year. After that project is done, there'll be $625,919 left on that bond.
Okay.
Okay, we're going to use up $425,150 on these three items that we discussed, and there'll be a remaining balance of $200,769 on that 1202 bond. The 1211 bond, we use that up and then some. Actually, currently on that bond, we're like $308 over, but we have $22,000 outstanding bill to go to equity for this building, because everybody's kind of sitting on their hands waiting until figure out what's going to happen here.
Okay.
They're not asking for it, but I'm assuming it'll something that'll happen in 25.
Okay.
So we got that 22,000 there is kind of in limbo. I guess we got to figure out what we're going to do with that.
part of the problem there, I think we've talked about this, but just to revisit is they can't give us a warranty on the roof because they use two different fabrics up there unwittingly, or subcontractor did. Their chatter is one solution is to go in and redo it. And I'm like, I would say, are you kidding? But right now, we have to kind of wait to see what they come up with. We've thrown out an idea, but haven't gotten a response to it yet.
We don't have to have a concern, to the best of my thoughts, any kind of concern for leakage or anything. They did a really nice job on the roof. It's what happened was a supplier sent two different products, and the guys didn't catch it. They put them on, and one of them's got this name on it, the other one's got this name on it. It's all the same specs and whatnot, just a different name, so the company's not going to warranty it.
That's convenient.
Neither company's going to warranty.
Well, no, because the one company that we were using, that had the contract, they'd be the ones that would be warrantying it. And I guess, never did see if the other company would warranty it because it's not kind of in our scope, really. It's kind of their baby as far as they want to do it. But the fact of the matter is, I mean, everything's compatible. They use the same glue, they use the same process. And, from the way it looks, we don't have to worry about any leakage or delaminating or anything.
Except that it's not warranted right now.
Well, how long would the warranty have been?
Well, typically they put a warranty is for a 20-year roof. Well, okay, along with that, that's with annual maintenance of some sort. So
Right.
you're paying for that. And the other thing is, how good's your warranty if your contractor goes out of business?
Exactly.
That's the other thing. But I guess we're kind of dancing to their tune right now for a little bit till we see what they come up with.
Okay.
We were thinking along the lines that if the cost to replace a perfectly good roof was maybe just pay us something less than that we could recommend that to the board. But no, they seem kind of hell-bent on pushing through but we will decide whether we mean collectively this group will decide if we let them back up on the roof to do that.
They ordered it. They looked at it when they put it on.
They didn't know it was a problem until the guy who does the warranty came by.
Yeah, right. That's where the problem was. Nobody had a clue, and so of course they blame it on COVID. That was the first thing I heard was COVID.
Certainly wasn't our mistake.
No, it wasn't. No, and they pulled this one off of this shelf and that one off. It come from the same supplier. All right, and so they probably have multiple.
They should make sure they are the same quality and they weren't trying to send us a cheaper one.
Yeah, well,
not that they would do that.
No, nobody would do that. But see, the other product is the Versico, and that's what we used over at the Justice Center. So we know it's a good. We know it's a good product. We know they got good warranties.
That's the first thing they put. That was the first one they put on.
We put on the Versico over there through a different contractor, of course.
Yeah.
And then when we did this contractor, well, who got the bid was it Genseal? Genflex. So it's
half Genflex and half Versico.
Different manufacturer, whether it's Haynes or Fruit of the Loom, I guess.
The other good news is there's not a penny in this budget for a new roof anywhere. We don't want to do any of those until we actually rebuild a building underneath. So.
And when we look at our capital improvement plans, whatnot, projects, just like you had brought up, Mark. Yeah, I mean, we don't know how things are going to be in the future. So does that mean we put those things on a hold, or do we get them done while the
maybe the price is low?
While the monies may be there to do it. I mean, we've knocked out a lot of projects, and there's a few more here that when they're done, by golly, we should be in really good shape. As things have just kind of skated by for a while.
Your budget proposal, how many percent above last year would that be? Is it 5, 10, 20, whatever?
I believe it's well, we readjusted the numbers again, but I believe it was around a little over 5%.
So it's
well,
not
3.5 was right. It was the salaries, right? I mean, that's.
Excuse me.
Part of your increase is the 3.5 for your staff.
For the salaries, yes.
That's included.
Yeah.
Yeah. Well, keep in mind his budget. He's got his operating, but then he's got the capital stuff, which has more variation.
Yeah,
that's true.
That's the big split, and I can run this around if you want to take a look at it. I kind of did a little
calculating.
Well, a little calculating just to kind of give you something to look at. If nothing else, give you some questions.
Sure.
Do I have that?
Everybody's going and Chuck's going. Okay.
So basically
what you got here.
Okay, what we did there is you've got on the on the gray area, of course. If you look at what's in red, those are the three items that we're going to run into bond.
Yep.
This year.
You
Okay.
have bond monies for that
Yes.
carried over from.
Yeah.
Okay.
All those other ones is we injected into the budget under repairs and maintenance, equipment, and if you look over to the left side, that's all your line items right there. The capital improvements for the future years, I guess, that's about a $910,000 chunk of change, for LP backup system, carpeting at Justice Center, main air handler upgrade at this building, Medicis upgrade. They've been Medicis. We did a majority of the upgrade a couple years ago, right after we got it out the juvenile center, but we opted. They told us at that time that with the engines they use, and I don't have a clue what they mean by it, other than that's part of the Medicis system. They break it up into engines, and so they said we could get by for a number of years without doing that. However, now of course they're coming back. Hey, when you guys can do those other 5 engines or other 8 engines? And currently, I'm of the belief that we can hold off on that for a little while. I'd rather get our current system operating at peak performance before we start adding more pieces to it, and we're not there yet. And let's see. For the museum was something, of course, that we hadn't planned for. So I had, we spent some monies this year that were not planned for that, but for the next going forward, I plugged $5,000 in a year in there just for basically roof repair and maintenance. And I guess I probably should have added that into future capital improvements, because I would imagine in 10 years or so we probably will be looking at doing the roof on that building. We're gonna maintain. I won't be doing it. I mean,
turn the building over.
So anyway, well, that if a person doesn't, that'd be.
We don't need another building.
No.
We already have it though. That's the.
Well, we can get rid of
Yeah. Well, it'd be a good time because we got it all. We'll have it all fixed up here and real pretty here in by the end of another 6 weeks.
Yeah, mid-October sometime should be done with their projects we're doing.
Yeah, we cleaned her up, polished her up.
Make a wonderful Christmas present.
Yeah.
It would. Yeah, it really would. And I know nothing about what you're talking about. So. But I mean, that is something that would have to happen, in the 10-year plan is, $300,000 to $500,000 roof on that building.
That much?
Yeah, we look. This one was $459,000.
Gonna put a hip roof on it or something?
It'd
be better probably.
Just build a pole shed over the top of it.
So it actually slides off.
What's that?
Might be cheaper.
Would be. It'd be a heck of a lot cheaper. They already got pole sheds out there. They could put that thing right inside a pole shed.
Without
We're
anybody
not gonna put it in a pole shed.
Without anybody noticing, the inside would be gone.
It'd be done. Yeah, the interior's done. You know, Chuck, there's some pretty good looking pole sheds up there.
Yeah, I know. You know, we've had enough talks about this. Unless you want your name on a building, come up with too many ideas.
Oh, crammity. Well, I guess
It'll be the RL building.
it'll be somebody else's building. I'm a short time.
Sounds like a plan.
So, well, I can't dazzle you with anything else. Is there anything any questions that are popping up, or I could?
So a couple things. You know, as time, the next few weeks, crunching on those capital items relative to the bond and not to the bond. See where they should fit, depending on where everything else is. You know, what was the other item? Two things. Can't remember number two.
Numbers in the last couple.
No, it's too much coffee. I think I just kicked in.
Well, maybe that was number 2. Now you can't remember number 1.
It'll come to me. Interesting. Sorry. Blanking.
Well, I guess. All right. Got anything to add?
No, I'm just observing.
All right. Well, thank you much. All right. Well, thanks for listening to us. Oh yeah.
We just have Chuck left now. I didn't have more coffee.
No, I'm so full of coffee, buddy.
It's his opportunity to go.
Thank you.
Okay.
I'll be right back.
That's my concern.
Are we on live now for the remainder, or we are?
You've been live.
We're not.
For 2 hours.
Okay.
2 days.
So, I mean, we're still gonna be on till we put the hammer down.
You bet.
All right.
Yeah, just to kind of maybe wrap up the preliminary levy discussion, whatever the number is.
Yeah.
You just give me if you give me a clue, then I just draft it for next week. I can do that at the meeting too, because you might want time to think this through, how you want to discuss it. You know, to Paul's point, I live with whatever the levy is. You know, my job is to make it work. To come up with something that you can decide on down the road. So maybe I'm a little more cautious or conservative in how to do this, but yeah, I'm the one that adjusts to the board. So.
Well, why don't we just go around, Paul? Where would you see that if you were to set a preliminary levy? What percentage are you looking at our goal?
Final or preliminary?
Preliminary.
5, 4, 5, 5. I'm good with 5. I really am.
Trying to find where my
5.
Yeah, I think the 6 is a little too far out there for me, but I think 5 gives us a little margin, and I'd like to see below 4. But we'll see how that goes.
You say below 4 for the final.
final.
Yeah.
4.
I mean, I guess, that 5, because I mean, like initially I was thinking of 6 because I mean, with contracts out there, I mean, that's just a huge unknown. Um, but yeah, I think, 6 is a little bit too much. But, now Rick, is a perfect example of our expenses increasing, how he's talked just about our water bills. I mean, we're facing the same issues that everybody else is of, your living and operating expenses are up.
Well, every government body is looking for more money, and they're going to try to find it somewhere.
So if that gives you an idea where we
Yeah.
kind of think, and then we've got about another week to set that, but then we do have some work.
Well, if it goes 5, 5, 5, 4, 6, averages 5, that's pretty easy.
There we go.
Just add it up, divide by 5. I'm trying to get the resolution back. I lost it.
I get it, and I appreciate Warren's comment on delaying maintenance and doing this, and I deal with that every day. But I've also had to make some structural changes in the basic operation to plug into a budget. And when I hear healthcare, the percentages of increase, and I hear the labor negotiation percentages, the COLAs, and all of the stuff, and to Joan's point of just the base expense going up. And I'm not saying now is the time to be reinventing how we turn the wheel, but I'm sorry I'm being pessimistic, but at some point in time in the future, we're going to have to reinvent how things are functioning, unless it would be good for me that property values for farmland go to $20,000 in another 7 years, which I don't see that happening. But it's, and I realize your job is the budget for 2025, and I'm talking general 3 to 5 year budget planning, and that's where.
Well, maybe I can throw something out there. Just I am not a kind of great visionary or anything like that, but some of the I think we're going to be seeing and dealing with this AI business for a long time, and how we don't know how it's going to affect what we do. In some ways, I can see it making it a lot worse, but in other ways, it may make it. There's a lot of things we do that are just processing, and I'm not diminishing what anybody does, but as soon as you get into something that's routine, you know what that means. It hasn't gotten into local government yet in general, but it's going to. It's inevitable. It's going to happen. I think trying to get some of our data management stuff, finance data, operational data, as liquid as we can to be able to manipulate it going forward, will give us a productivity increase of sorts. And then we got to talk about, well, what are we doing? What shouldn't we be doing? It's not the same as it was when I came here 12 years ago. I'm sure it's not going to be the same in 12 years from now. I don't know what's out on the horizon that might be as catastrophic as might fear, but it's probably nothing we're doing. It's how we react to something. I thought we were pretty good at reacting to the pandemic. We are generally in a kind of industry, government, that is there regardless. Doesn't go away. Many people's chagrin, but it's also there when after the catastrophe to deal with it. So I think I hear what you're saying, and if I'm sitting on your side of the table, I'd be worrying about farm prices, the general markets. But I suspect there's things that we're not aware of that are even more risky. The system right now that we live in this part of the world is actually pretty stable, and I don't know how it's going to change. But the other things that happen, case in point, a pandemic or 9/11 or stuff that suddenly twists everything into something that's not recognizable anymore. Well, I don't know. I was just thinking this morning because I get stuff emailed to me all the time. One was on AI and what, how to become aware of what it means. I'm 64. I can't remember my stupid passwords, but it's going to transform some aspect of what we do. There's no doubt about it.
This whole process puts the 5 of us and you in a situation where I think requires us all to make sure that we soul search in the right direction, that we are, because it is our responsibility, yours for all the staff under you, ours, our constituents. Yeah, I understand where Mark's coming from because he is in a field of study or work where his is volatile, even more volatile than the one I'm in, the work field I'm in. Mine is an interesting field nonetheless. And yes, it is changing all the time too, but it doesn't change drastically, basically on the people you see and the clientele you have. But when you enter this constituent world, you have to answer, so to speak. And I brought it up before, the deception. I agree. Okay, we're not being deceptive. I don't want to seem that way, and I don't think we are intentionally ever being deceptive. But I don't want to come across that way, and I appreciate Mark's approach to it, with his 4 and being 5, and Joan and Warren and Gary. But we all have a place where we're coming from that we have to answer to, whether it be internally, externally, or a combination of both.
Yep.
And if we don't forget that, then we're doing the right thing for the better good. Because we are in an interesting age and in an interesting world right now. It's not the most kindest world we're living in. Fortunately, we live in northern Minnesota, which isn't a terrible place to live, so to speak. And so that's in our advantage. And I don't think any of us are forgetting that. when we deal with, who are we responsible to? So and this has been hard being, this is only my first year around in any form of politics, period. Other than being in the military for 9 years. That's the only other politics I ever involved in. And then I was in charge most of the time there, so I never had to, you know, you only had to answer to the one or two above you. So I appreciate where we sit and where each one of us sit, but it's a hard situation we're all in, you know, because we're answering to a lot of dollars.
Well, we are, and with inflation, I mean, that affects government and our employees. But whatever we decide affects the citizens that are also dealing with inflation. And so it's a balance.
Well, that's the priority, is the citizens.
That's right.
We being the organization, the staff, the employees come second. We need them to make sure that priority number one is addressed, taken care of, responded to, whatever is required of us.
I think too, you know, like just playing off of, you know, Mark's personal experience. I mean, that's kind of where, I mean, farming, it's,
Well, you've been there.
yeah. And, you know, I just think about in the early 2000s when milk prices were about, I mean, as low as they'd ever been. And we knew in order to keep our farm going, you know, if our kids wanted to, you know, come into it, we needed to make a change. And I mean, it was a hard decision to make because, you know, when we went from conventional to organic, we had to change totally of how we did our day-to-day work. And, you know, I mean, there was, you know, those first few years they were tough. But, you know, in the end, it was the best decision that we made and that we could make for, you know, our farm. And that's, I think, too, like here, you know, you talk about how we do things, you know, pretty much the same all the time. But, you know, there's sometimes where, you know, you might have to look at doing a difficult change. But I think also, too, like when you talk about AI, I just think of, you know, there's a lack of workforce. So we're going to have to look differently at how we provide the services. You know, like, I mean, you look at, you know, the incinerator where we've got robots in there now. I think we're going to have to look at more automation in order to perform the services that our citizens expect and appreciate that we supply.
When the robots get unionized and demand health care.
And breaks.
They need to be fixed. But you know, Bruce Newhouse would come to our public hearing and basically say similar things, and you know, it's always interesting to listen to, and hard for the county to respond to the individual farm or even the economics of farming, but
just the different parts of the county.
Yeah, but we can help that family that's in distress due to their circumstances. We can provide the roads to use. We can provide law enforcement to make sure that it's safe. We can do those things to support that. It does come at a cost. It can't be done for nothing, obviously, but I never thought that's what he was saying. But I mean, it becomes kind of our balance because we're on both sides of the equation. We need to make sure that that all works out there to the best of our ability. And we're not wasting their money doing things the way we decide to do them. And I think it's always best to try to be figuring out where we have to make the next set of improvements. And, some of that is thrust upon us when people leave or retire or what have you. Some of it is just sitting there waiting to happen. And, I get paid pretty well to be thinking about that, not to how do we make sure this never changes. It will always be this way. It has to be what's the next part, kind of what you were saying, well said, so that we're ready to deal with whatever comes, whether you're pessimistic or optimistic.
I can always concerned about the condition of our buildings and programs and stuff. And I think we need to keep them up to date as much as we possibly can, because if the water does, not the water, the economy does go right down the tank, at least we've got those things up to a good status at that point, and we can ride out a real problem. But if we've got holes in the roofs and no money to address them at all, we're going to have a problem.
Yeah, it does remind me on the litigation. We may be able to get some money back from what.
Any indication of what's going on there?
Yeah, mediation has been set for October 21st.
Yeah.
In fact, you should be getting a call from.
I'm supposed to be
deposed.
It's on your schedule. isn't it?
subjected to what the heck did they call that? They're going to deposition. I have no damn information to provide.
Save it for the deposition, Warren. Don't explain it here.
Well, nothing more than never came out at a board meeting.
Wait until then and work with the attorney.
I've told the attorney that.
Okay.
She wonders.
Please.
Fine, good statement.
Get it.
I'll just leave it there then.
Yes, good.
Exactly.
Anything else? If not,
I'll come in with a draft 5%.
can you send us what your options were though? And
Sure.
so we just have that
I did.
information.
They're on
from
the.
It's
yeah, I mean, is it on our?
It's in the packet
It's in the packet.
Oh, okay,
Yeah.
for today.
gotcha. Very fine.
But I actually don't have 5% on there. I've got this one, but
5.1.
Yeah, but it'll be just under 29, and I think it's a levy increase of like 1.3 or something. So 1.3 plus.